before I present the findings, a quick look at the early childhood education and care system in England. That it has two key policy objectives: is to support children's early learning and development and to narrow the achievement gap, but also to support families' economic well-being, with a particular focus on maternal employment and narrowing the gender gap in employment. The main policy streams are funding for early education from the age of 3 to all children until they start school, and that's for 15 hours a week during term time. And why disadvantaged 2-year-olds are entitled to these 15 hours from the age of 2. Children with working parents actually get more early education, so they get 30 hours a week from the age of 3, and also their parents can claim childcare subsidies to cover part of the cost from the day they're born. In terms of delivery, about 20% nationally, only 20% of early education is delivered in school-based settings. These are mainly nursery classes. And this is a national average. So in some areas, there are hardly any or no nursery classes at all. But the majority of early education childcare is actually provided by a mix of profit and not-for-profit nurseries and childminders who basically decide where, when, and to whom to deliver a service, and also they decide how much they charge. Local authorities do have a statutory responsibility to make sure there are sufficient places to meet local needs, but in reality they have very few powers and even fewer resources to influence what actually providers do. There are some inbuilt, so there are some sort of historic weaknesses in the system that have been there for a while, and we'll see they're still there. So the services are very fragmented and of variable quality. They are not always accessible or responsive to the diverse needs of different families. There are also considerable barriers to access. So the early education entitlement is not always free, and fees are high, and there are a barrier to access for some families. Low pay of early education childcare staff means that the sector cannot attract high caliber practitioners that are required to support children's learning and development in what are the most formative years. So I'm going to look at the findings in relation to how participation to early childhood education and care was affected during 2020 and 21, and then I'm looking what happened to provision. Looking at how attendance was affected, whereas children under the age of 5 missed early education. Most of them missed during the first lockdown. As you know, most settings were closed to most children, but even during the third lockdown, with the early years setting actually remained open to all children, about half of children, there were about half of children there that you would have expected if a pandemic had not happened. After and between these lockdowns, attendance went up very quickly to 70, 80, and even 90%. And what we found in the qualitative interviews was parents' concerns about children, the impact of children missing early education, and the strain of providing full-time childcare at home, particularly among working families with strong drivers to decision to send children back to an early year setting. But even when children went back, what we must remember that their early education was continued to be disrupted by things like self-isolation rules and temporary closure. And in autumn 2021, there was still 10% of children that were missing from early education. And as Juliet said before, I don't think, some people say 90% attendance looks good. Well, to me, 10% missing is a big finding. Particularly because all the evidence points to the fact that lower attendance was particularly an issue among disadvantaged children. And what this study and other studies have shown that COVID has widened inequalities in early education. In terms of what the implications were for family, for parents and their children of not having access or having disruption in early childhood education and care services, as you remember from those days, the pandemic was very challenging for parents. It was particularly challenging for mothers who really were under considerable strain to provide full-time childcare without access to early education childcare services, with many reporting mental health problems, while fathers were more likely to report the benefits of being able to spend more time at home with their children. Parenting without early education and childcare services are particularly challenging for lone parents, for families with school-age children, and also with families with children with additional needs. And some working families, and particularly mothers, lost some income because disruptions in arrangements meant they had to reduce their working hours, take unpaid leave, or even leave work. In terms of the implications for children, these were reported by parents and early years professionals, and they were very consistent in terms of what the consequences were on children of missing, not being in early years settings as much as they would have expected to be. So there were widespread speech and language delays, as few opportunities. Children were at home and had few opportunities to develop their communication skills. They missed, because they were at home, they missed an opportunity to socialize and to develop self-regulation skills, which in settings reported an increase in social, emotional, and mental health needs. There were delayed physical development because children at home spent less time outdoors and more time in sedentary activities. And because more children, disadvantaged children, were more likely to miss early education, the development, it was believed the development gap is widening. Looking at how COVID, so the first 18 months, has affected early education and childcare providers and the future of provision, there is a future of provision. There were significant impacts on services, as you can imagine, due to the loss of income. Take-up was considerably lower for many months, and also an increase in cost associated with COVID. The scale of the loss varied, but providers had to use reserves, take on debts, and they were much worse financial position towards the end of 2021 than they were before COVID. Overall, despite all these financial difficulties, possibly partly because the sectors proved to be very resilient and there's been some financial support locally and nationally to support the sector, the numbers of places and the number of providers in terms of trends was similar to what you would have expected as a pandemic had not happened. So, for example, the number of places has declined a bit, but so has the number of children aged 0 to 4. But experience varied enormously, and there's still lots of providers that are out there. They're very vulnerable financially, and that might be far less resilient to future shocks, and also ongoing challenges that were there even before COVID. And last but certainly not least, and probably more importantly, the sector is facing a workforce crisis. They're really struggling to retain and recruit staff. And although they had problems before, this has certainly been exacerbated by the pandemic. In terms of implications for provision, what families go out when they go out there now, what they find in terms of early childhood education and services, they find more expense in services because there've been above inflation rises in the fees parents have to pay. So this was an issue before. Now with the cost of living crisis, it's likely to be that even more families will not be able to afford early education and childcare. Also, as providers need to balance the book in a very financially precarious position, there's some children are less likely to get a place, for example, children with additional needs, because they require additional support, which is not always covered by the local authority. Part-time places might be more difficult to get because they're less profitable. A family who cannot afford to top up the early education entitlement, because top-up fees are very much used to subsidize the early education entitlement funding that many providers think is inadequate. And also staff challenges pose considerable risk to the quality of children's early education experiences, as well as probably sufficiency. And to conclude, a key lessons for the pandemic for me, I've been doing research with parents in early education childcare for 25 years, that I can sense the attitudes and expectation has shifted. So many parents have realized, this has been a big national experiment. You take away something and see what happens, something that in research you will never be able to do. And you see what happened, and what parents have realized, they can really not replace the learning and development opportunities that an early year setting can provide. Even with time and resources, lots of parents were at home and they were furloughed, and some settings provide remote learning support, but that could not replace what a setting can provide. And also, let's face it, as much as we love our children, parenting full time when you're also trying to work is a nightmare. So the role of early education and childcare has become much more important than it was in the eyes of parents before the pandemic, because they see what happened when you take it away. And in the meantime, they're asking many questions about why are the different rules for accessing and regulating school and early education and childcare settings? And the kind of things that we're raising, apart from the usual issues that the early education entitlement is not always free, why school services are free. But there were issues during the pandemic that highlighted this difference. For example, why when schools were open and to whom was very much regulated nationally, whether a childminder or nursery remained open was down to the individuals nursery owner decision. Similarly, remote learning, why all schools were asked to provide remote learning. Some early year setting did, others didn't. And lastly, why children did get some extra in schools, got some extra tuition, not as much as we'd wanted, but certainly got some extra tuitions. Parents were not allowed to take the 15 hours early entitlement that they missed during, for example, lockdown, for example, during the summer. So parents are increasingly frustrated by these differences and also by unregulated fees that really allow providers to make unreasonable demands to access what they now regard as an essential service. And there was a clear example of that during the pandemic, where parents were asked to pay their nursery or the childminder full fees when actually children could not attend. So there is a growing consensus out there, not just among researchers, academics, but parents, that children should have a right to early education, but that the current system does not guarantee that right. So our recommendation, and there's much more of these in the report, but in terms of national policy, we just not only need more funding, but we need funding that needs to be clearly linked to the 3 pillars of early education childcare services. Sufficiency is certainly very important, that there are enough services where and when families need them, but that's not the only important things. And recently too much emphasis has been placed. So, well, if enough settings are open and if enough children get to the place, that's all well and good in the system. Well, it's not, because equity of access, making sure that all children can access a place, and quality of children experience is equally important, even during a health emergency. So we're arguing the funding, any additional funding that goes into the sector needs to be clearly linked to policy objectives and specifically delivery or workforce condition, which must be developed in consultation with stakeholders, so parents, providers, local authorities, also what we know from the evidence that support the 3 early education and childcare pillars. And also there needs to be a big change, in our opinion, in terms of local policy. We need a stronger local authority role with new statutory responsibility and dedicated funding to make sure that they can more consistently intervene in the early education, their local early education childcare system. There's a huge inconsistency at the moment in terms of how and where they intervene. And also we want to make sure that some local authorities already have these, but we need to make sure that every local authority has an early years lead responsible for ensuring that strategically, operationally, high quality early childhood education and care is a key component of the local offer to families with young children. And if you look at the report, there is much more that we say about what an expanded local authority role should look like and how would that benefit children. So that's all for me. Thank you very much.
Thank you so much, Ivana. That was a fascinating presentation. If you have questions, please just hold them for now, because we're going to carry on with the next speaker. So I'm pleased to introduce Eliza Garwood, who works at the Centre for Children and Families at NatCen. Eliza is a senior researcher,
Okay, good morning, everyone. It's great to be here. So today I'm going to talk about the 2021 survey of childcare and early years provider, or SCAPE, the thematic report, and I'll be particularly focusing on the qualitative component of the study that looked at recruitment, retention and business planning for early years providers in England and was funded by the DFE. So I'm just briefly going to look at the research aims and methods, then go through some findings on recruitment and retention, and then finish with workforce and business planning. So there were 5 aims of the research, but for this talk, I'm just going to focus on the final 3 that focused on the qualitative research, which were to explore the factors associated with recruitment and retention, to explore providers' decision-makings regarding staff costs and business models, and finally, to explore issues faced by early years sector arising from COVID and the pandemic. In terms of methods, this was a mixed methods approach. The quantitative component consisted of secondary data analysis of the workforce data from SCAPE 2021. The survey covered just over 6,500 group-based providers and just over 2,500 school-based providers, and the data collection took place between March and July 2021. The qualitative component followed this, and it was based on 35 in-depth telephone interviews with setting managers from school-based and group-based providers. Interviews for that took place between October and December 2021. The last couple of interviews that we did followed the identification of the Omicron variant, but all interviews were conducted at a time when there wasn't any official government COVID-19 restrictions. And as I noted, I'm just going to be talking about the qualitative component of the study, but the quantitative findings are covered in the full report. If you want to see them, you can, and that's all published. So as I said, I'm going to start with recruitment and retention. So when thinking about issues faced by the earlier sectors arising from COVID and the pandemic, we saw quite a variety of responses, and several of the aspects that were highlighted were viewed as quite long-term issues in the earlier sector, predating COVID, but they were seen as quite exacerbated or worsened by COVID and the pandemic. But that said, there were a couple of issues that came up that were directly linked to COVID, and I'll explore them more in the business planning section. So some providers were more heavily impacted by staff turnover than others, with respondents noting higher retention rates in school-based providers. And that was also reflected in the quantitative data. And the interviews that we did in as part of the qualitative component suggested a couple of reasons for this. Firstly, that they had a more favourable working environment, particularly when thinking about work hours and holidays, that there was more opportunities for professional development and personal training, that there was quite a good salary progression, and that it offered more supportive working conditions, and particularly that being attached to a school offered those supportive working conditions. And the higher rates of retention in school-based providers generally meant that they didn't face as many recruitment challenges. In contrast, when we looked at group-based providers, they discussed quite a few reasons that they felt like their staff might be leaving the settings. COVID-19 and the strain of working through COVID-19 was highlighted more prominently in our interviews with group-based providers, and the pandemic was seen as leading to staff re-evaluating their careers, reassessing their life choices, and for some it meant that staff from group-based providers moved to other industries, or some workers from overseas moved and returned to their home countries. We also found more of a lack of financial incentive to stay in the roles, and managers reported that staff moved to similar jobs in sectors that had higher rates of pay, or even that staff moved to new industries even where pay wasn't as high, but it had better working conditions. And finally, that group-based providers had less flexibility and poorer work-life balance, particularly that was in comparison to school-based providers, which were seen as offering more favourable working conditions in terms of holiday and hours. So higher turnover in group-based providers meant that they were recruiting more regularly, and also that they found this a little bit more challenging. And managers spoke about the difficulties they had, particularly with recruiting what they called quality members of staff. That was because of a couple of reasons. Managers felt like staff had an inaccurate or idealistic view about what their role would entail, and that made recruiting and keeping staff more difficult. There were also concerns that staff who applied weren't actually qualified for the roles that they were applying for, and some managers felt that their places that they were advertising their jobs weren't attracting the right candidates, particularly mentioning certain job websites where they could advertise for free or using social media platforms as unsuitable. And the challenges that came with recruiting quality staff, as I said, were believed to be quite long-term, but exacerbated by COVID. There were a few cases that we found where managers noted COVID-19 as kind of more directly as the reason for the challenges, but that was in relation to the number of applicants that they were receiving, and that actually that number was quite low. Okay, so when looking at business planning for early year settings, we again found that the type of setting was a major factor. So I'm going to start with school-based providers again first. So participants from school-based providers reported relative stability in terms of their finances and business planning, making few substantial changes in terms of their business models. And managers from school-based providers said that they felt like they were less impacted by COVID because their funded hours continued to be paid even when children weren't attending nursery. School-based providers receive 72% of their income from free entitlement funding, so their income remained relatively stable. As I said earlier, participants also commented on the value of being attached to a school, explaining that they were able to use school staff to cover absences relating to COVID, particularly absences relating to sickness or isolation, and that meant that they didn't need to use as many agency staff, and that brought their costs down. And again, that they experienced fewer problems with recruitment and retention, and so didn't need to invest time and funding in recruiting staff. Moving on to look at group-based providers. So on the other hand, they saw an increase in financial challenges over COVID. So free entitlement funding only covers part of group-based providers' costs, with the rest coming from parent fee-paying hours. And the extended lockdown periods and uncertainty about reopening or staying open caused them challenges. And so some of this was offset by the furlough scheme, but managers talked about the fact that this didn't cover all of their costs. So it was still quite a financial strain. They also had to rely more heavily on bank and agency staff, and that came at a higher cost. So COVID put pressures on finances or worsened kind of existing financial issues that settings had. And that led to managers making a couple of changes. So staffing levels and contracts reported as changing. So managers choosing to either reduce the number of contractual hours that their staff are guaranteed, or even putting all of their staff on 0-hour contracts. Managers also reported hiring lower qualified staff so that they were paying lower wages. And managers who owned their settings in particular talked about taking out bank loans or using personal savings to cover financial deficits. Now, so far I've spoken about group-based providers and school-based providers separately, but there were a couple of issues that we found that both types of providers faced. So first, it was that participants reported a reduction in parental demand for childcare. So that was seen as both kind of a decrease in the overall numbers of children registered at nursery, but also the numbers of children number of hours children were attending per week. And COVID was seen as the primary reason for this drop in demand, with parents working from home or working more flexibly seen as a potential reason. There were also kind of some continued concerns about the spread of infection and health risks to children and their families. And that was seen as a key driver in the loss of income for settings, and a major concern for future viability if that didn't pick up. The second finding that applied to both group-based and school-based providers was the rise in the numbers of children needing SEN support, specifically emphasising delayed development of speech and language and physical skills. And now it's really important to note that managers themselves framed this as an increased need for SEN support, but it doesn't necessarily mean that more children were identified as having those needs, or that they will in the future be identified as having those needs, but it might be that children needed extra support because they missed out on learning and development opportunities during the pandemic. So what managers described as SEN support could also include educational recovery. And COVID was thought to have led to that increase in a couple of ways. So firstly, that the needs of children were not being recognised before they started nursery. So that might have been because children started nursery at a later age, or it could be because there was disruption to the standardised development checks. And secondly, that COVID and lockdowns meant that children had more limited social interaction for the first few years of their lives, and that might have had a detrimental impact on their development. And so in order to provide support, managers talked about including a couple of new measures. And so they noted that they were having to spend more time with children, that they were putting children into smaller groups to help deal with that, that they were actually spending more time with parents or other professionals like health visitors, and that they needed to allocate extra time for paperwork. And all of that meant that it was leading to quite an increase in workload for settings and for their staff, and it was creating quite a challenging working environment. And to manage that, they talked about a couple of extra things that they did. So some settings hired additional staff, even if the number of children they had stayed the same or decreased. They might have increased their SENCO provision or actually sent staff on extra training. And some reported buying specialist materials to support children. Saying that, they also spoke about how those new measures came at quite a high cost for them. So settings who were struggling financially weren't able to always use those new strategies. Even if they wanted to, they didn't have the funds to invest in that. And one thing that came out that settings said they would really like to see more of is free or subsidised SEN training for their staff to access, so that actually they don't need to rely on their SENCO, and some of their staff can support and offer that support to children. So just to wrap up, so overall we found that challenges with recruitment, retention and business planning really focused on particular providers rather than the sector as a whole, with group-based providers facing more significant challenges. But there were a couple of issues that I highlighted that were reported across the board, particularly those changing patterns in parental demand and that need for extra support with SEN. And those are the ones we didn't kind of see a change or a difference with the providers. And those are the ones that were kind of more directly linked with COVID. Okay, I'll finish up there. Thank you very much.
Thank you, Eliza, for a sort of deep dive into what providers were facing. So now I'd like to introduce our third speaker, Dr. Claudine Bowyer-Frey. I think I got that pronunciation right. Associate Research Director .
So this is work that's carried out with colleagues at the Education Policy Institute and the University of York, and it's funded by the Education Endowment Foundation. So as we've heard, children who were starting school in September 2020 had had to cope with lack of access to early years settings that meant that they didn't have the typical developmental opportunities, they didn't have access to social interactions, they didn't have access to the physical activities that they would normally have. And that meant that the children who were starting school in that academic year 2020 were coming from a very different preschool landscape than previous cohorts. And we thought it was important to try and look at what that might mean for children's educational and socio-emotional outcomes. So the main research question for our study was, what is the relationship between reception year children's experience of the pandemic and their socio-emotional well-being, language and numeracy skills? And we took an exploratory approach to this, and we tried to pull together data from pupils, families and schools. So pulling all of that together provides useful insights into the experience of the pandemic and the impact on children's outcomes. So I'll move straight into our measures because we're tight for time. So I just want to get on to what we actually did and what we found. So we carried out school surveys, we carried out parent surveys. It's mainly the school surveys that I'm going to draw on today. We also collected child level data using an app, which the teachers collected the data for us. So we have data on vocabulary, number skills and socio-emotional well-being. And we collected early years foundation stage profile data. And it's the surveys and the EYFSP data that I'll focus on today. So we had a staggered approach to the recruitment of our schools. We recruited our schools first, then we recruited our families. We had 94 schools taking part in the study, and you can see this is a spread across the country. We selected those schools via direct contact and via social media. So this is a self-selecting sample. In terms of the families, once we recruited the schools, they then sent out surveys to all of the reception class parents in their schools. And from those survey respondents, we randomly selected at least 10 children to take part in the study. And we did that primarily to reduce burden on schools because they were collecting our data. So we didn't want them to feel that they had to test every child in their class because we appreciated that they were under a significant amount of pressure. We did manage to recruit over 1,000 children to take part in the main study, but we also collected an additional 2,000 and some early years foundation stage profile scores. So in terms of what our sample looked like at the school level anyway, we had 10% more urban schools in our sample compared to the national average, but that's partly because we needed schools that had enough children in their reception class that would allow us to collect the data that we needed, and urban schools tend to be larger. In terms of the number of children eligible for free school meals in our sample, we were about the same as the national average, but the children who had English as an additional language in the schools we were working with was a much lower percentage. In terms of our families, we had mostly mothers who responded. So 90% of the respondents were also spoke English as a first language, and 96% of the children who took part in the core study spoke English as a first language. Almost half of our sample had education to the level of higher education or above, and most of our sample were in employment, with a third being professional. So it's important, I think, to bear all of that in mind when we're thinking about the findings, because this isn't a representative sample, but it is, an indicative sample, and it does give us some insight into how families were coping and schools were coping with the pandemic. So if we move on to the school surveys, what we wanted to ask schools was not just about how they felt their children were doing, but also about their experiences of trying to educate children in the midst of a pandemic. So we asked questions about their concerns about children. We asked them about whether they were prioritizing time in school differently. We asked them about how they were planning to support children, but we also asked them about their experiences as a staff group and what kinds of things they had in place for their staff. So in terms of their concerns about their children, over 3/4 of the schools that we surveyed felt that when the children started school, this particular cohort needed additional support when they entered the school. And at the end of the year, over half of our schools were still saying that this cohort needed more support than previous pre-pandemic reception year cohorts. And this was particularly the case for literacy, communication, personal development, and these were all areas of concern throughout the year. And they strongly felt that children who were able to attend school during that January lockdown in 21 were significantly advantaged over those children who were homeschooled. In terms of the earliest foundation stage areas, we focused on the 3 key areas of communication and language, physical development, and personal, social, and emotional development. And then we also looked at 2 specific areas of literacy and maths. And what this shows you is the number or the percentage of schools who were concerned about these different areas before they started school, before the children started school, and then again at the end of the year. And what you can see is that overwhelmingly schools were really concerned about communication, language, about personal, social and emotional development, and about literacy and maths to a certain extent. They were less concerned about physical development, but the concerns were there. But what's striking is that even when we asked them at the end of the year, although the concerns had reduced, there was still a large number of schools that were expressing concern about areas like communication and language, personal, social, emotional development, and particularly literacy. And this finding of personal, social and emotional development also comes out in the qualitative work that we did with schools, where they were telling us that they were really concerned about children's social emotional well-being as well as their educational outcomes. And I think it's important to remember that schools were working in incredibly difficult times, and some of the things that schools told us about working during the pandemic was concerns about workload, concerns about staff well-being, managing staff and pupil absences. Reaching hard to reach families was something they were particularly concerned about. They weren't able to contact all families that they felt needed support. So they were really trying to educate these children in a very difficult time. And the other thing they said was that, trying to do live lessons with children in reception was just really challenging and wasn't really seen as something that they felt was effective. So a lot of the pressure was then on parents to do worksheets and to find ways of supporting their children to do these activities. So it's a very different and challenging way of working. So that's what schools felt, but how did children actually do? And to look at this, we use the earliest foundation stage profile. I'm not going to go into detail because I'm sure you're all really familiar with this, but basically this is the statutory assessment which teachers use at the end of reception to look at whether children are at the level they're expected to be in these different learning areas. So we've got 5 learning areas here, and we also looked at the underlying learning goals as well. Now, in the academic year that we're thinking about, the EYFSP wasn't mandatory, but schools told us that they were still doing it because it was a really useful tool for helping children to transition it up to year 1. And they were happy to share that data with us. So we have earliest foundation stage profile data, which obviously originally we were going to get from the NPD. So we have a much smaller sample than we wanted, but still over 3,000 children. And in terms of the level of free school meals and children learning English as an additional language within our 3,000, we were a little bit lower than the national average, but still, we're not too far off. And the way in which we obtained this data was in terms of whether the individual children who schools were assessing had reached the emerging level, achieved the expected level, or were at the exceeding level in terms of those different learning areas. And we were then able to compare that to the national average from 2018-19, so the pre-pandemic cohort, who had achieved at least expected, so children who were in the expected or exceeding groups. And we also were able to calculate the good level of development, and children are seen as reaching a good level of development if they reach at least expected in all the 5 areas that we looked at. So that gives us kind of overview of where the children are. So what this graph shows you is the percentage of children in our sample who reached emerging, expected or exceeding in each of those learning areas. And what you can see is that with the exception of physical development, only sort of 3/4 of our children were in the expected level. There were some children in the exceeding, but what's worrying is that a large proportion of the children were in the emerging level at the end of reception. And this was 37% in literacy and 30% in maths, and then 25% in communication and language, which is quite a worrying picture. And when you look at that compared to the national average from the 2018-19 cohort, you can see that there are percentage point differences between the national sample, which are presented here in red, and our sample, which are presented in blue. And that's across all the different learning areas. Now, what's interesting is that even the national sample, it's not 100%. The picture is still not great. You know, we've still got less than 80% of children reaching expected levels in maths, and just over 70% in literacy. But the COVID picture is worse. That's made it look, the pictures looks a lot worse. In terms of, so we can then disaggregate by the typical demographics that we like to look at in terms of things that usually predict children's outcomes. And we can do that in our data by learning area and by the underlying learning goals, but we haven't got time to dig in that level today. So I'm just going to give you the good level of development picture. And what you can see here is the percentage of children in our sample, which is in the blue bars, and the percentage of children in the national sample, which is the grey bar, who reach a good level of development. And in the white, the figures in white are the percentage points difference between those two cohorts. The first thing to note is that overall, there's just over 13 percentage points difference between our sample and the national sample. So we've got fewer children in our sample achieving a good level of development compared to the national data. If you look at the data disaggregated by gender, we do see the typical pattern of girls outperforming boys, but we do see a drop for both groups. So both groups of children are doing worse compared to the 2018-19 sample. If we look by free school meals, in terms of thinking about levels of disadvantage, we do again see the pattern that we usually see, which is that children who are eligible for free school meals tend to, a smaller proportion of those children tend to reach a good level of development compared to the national sample. What's interesting here is that the percentage point difference between our sample and the national sample is only 1%. You know, the difference between those two figures is only about 1%. So what this data is showing us from our sample is that the disadvantage gap hasn't widened. However, only 44% of children eligible for free school meals reaching a good level of development is incredibly worrying. And of course, the other thing is that children in areas of disadvantage may have access to more resources to recover that sort of lost learning, that lost opportunity for development, which means that as time goes on, we may well then see the gap widening as the children from areas of disadvantage find it much more difficult to recover those skills and those experiences. Where we do see a big difference, a worrying difference, is for children who learn English as additional language, where the percentage point difference between the national sample and our sample is 16%, compared to 13% of children who don't speak English as an additional language. So this cohort appeared to have been particularly affected, and there's lots of reasons why that might be the case. And obviously, the term EAL is quite problematic in and of itself because it's a huge umbrella term. And also this, doesn't reflect what children might be able to accomplish if they're tested in their own language as opposed to tested in English. But the fact remains that in our education system, these children are assessed in English, and therefore it's really important that we find ways to give them the skills that mean they can achieve their potential on the statutory assessments. So schools report disruption to children's learning. There's some recovery reported, but concerns still remain. EOFSP data suggests that our children are not performing at the same level as pre-COVID, particularly children from early years. And we're finding very similar findings in a longitudinal study that we're currently doing, which is showing that even now, teachers are still saying children are coming to us that are not at the levels that they're expected to be, and yet we're expected to get them to pre-pandemic meet pre-pandemic expectations, which is putting a lot of pressure on schools, a lot of pressure on children. And I think the question we need to ask is that realistic or fair? And it's not about reducing our ambitions for our children, but rather thinking about ways in which we can ensure that children have the opportunities to develop, to achieve their potential, but without putting additional pressure both on them and making some of them feel like failures, and on teachers to meet these expectations. Yeah, that's all I've got to say.
Thank you so much, Pauline. That was a fascinating presentation, and it takes us very nicely onto our final presentation of the session, given by Imran Tahir from the Institute for Physical Studies.
Good morning, everyone. It's a pleasure to be speaking to you today. At the IFS, we're currently undertaking a review of inequalities called the Deaton Review. We're looking at inequalities across a broad range of different dimensions. In particular, inequalities in health, in wealth, in income, inequalities by gender, race, and importantly for this presentation, we're also considering inequalities in education. And in this presentation, I'm going to be focusing on showing you some of the highlights from our work on education inequalities in the UK, and also consider how the COVID-19 pandemic has had implications for the patterns of educational inequalities that we see in the UK. So let me start by showing you this chart, which I think is quite a striking chart. What it shows you is attainment gaps by eligibility for free school meals at different stages of the education system in 2019. The yellow bars here show the attainment for children who are eligible for free school meals, and the green bars are the attainment for all other students. And what you can see is that at every age we look at age 11, at age 16, and at age 19, there are significant differences between the attainment of children who are eligible for free school meals and better off students. So for example, at the age of 11, whilst students who are eligible for free school meals, just under 50% meet the expected level at Key Stage 2. Nearly 70% of all other pupils, so the wealthier pupils, meet the same benchmark. And there are similar significant differences in GCSE attainment and also at age 19. So children from richer families tend to do better at school. And the gap in attainment between children from rich and poor families has persisted over time. This chart shows you GCSE performance by eligibility for free school meals between 2006 and 2019. Again, here the yellow shows the attainment for children who are eligible for free school meals, and the green is for all other pupils. And you can see throughout this period, there's been a consistent gap between the attainment of people who are eligible for free school meals and other pupils. And the really striking thing is that the size of this gap has remained fairly consistent throughout this period. Now, of course, family background is crucial, but other characteristics are also very important for inequalities. This chart shows you educational attainment at the end of primary school and at GCSE along 3 different dimensions. So household income, gender, and also ethnicity. And firstly, you can see that by household income, there are these significant gaps in attainment, which reiterates what we've seen in the previous slides. The nice thing here is, though, that we don't just look at household income as a binary thing. We're able to look at quintiles of household income. And you can see that at the very top end, so the children from the 20% richest families, they do significantly better in their education. Almost 0.5 standard deviations higher attainment than the average pupil. We're talking really big magnitudes there. Gender also matters. So as we heard earlier, girls tend to do better at school. We also know that girls do better in higher education as well. Now, the trends for ethnicity are slightly more nuanced. Children from ethnic minorities tend to do worse early on in their school career, but when we get to GCSEs, most ethnic minorities on average do better than white British students. Now, this chart shows you each of these different dimensions independently and separately, but a key thing we find in our report is that the intersections between these different dimensions are also very important. So I'm going to begin by showing you the intersection between eligibility for free school meals, which is a proxy for household income, and ethnicity. And what you can see from this chart, which shows the share of girls achieving grades 4 or C in GCSE, English and maths by their eligibility for free school meals and ethnicity in 2019, is firstly that for every single ethnic minority, for every single ethnicity, children from better off households do better in their GCSEs. However, the disadvantage gap varies quite substantially when looking at different ethnicities. So at one extreme, we've got Chinese students on the far right here, where you don't see much of a disadvantage gap. In contrast, and at the other end, for white British students, you see a massive disadvantage gap. So in particular, girls who are eligible for FSM, around 40% of them are achieving good GCSEs in English and maths. That's compared to almost 70% of all other pupils. That's a gap of around 30 percentage points, which is really quite stark. Now let's consider a slightly different intersection. This chart shows you the intersection between gender and ethnicity. So here I'm showing you the share of pupils achieving good GCSEs in English and maths by gender and ethnicity. What you can see is that for each ethnicity, girls do better than boys. However, the gender gap varies quite substantially between different ethnic groups. So in particular, the largest gender gaps are for students of Black Caribbean and Black African descent. What happens when we put all of these different dimensions together? Well, we get this chart here. So this chart shows you the intersection between FSM eligibility, gender, and ethnicity. And it's really one of those charts which you can stare at for a very, very long time. And indeed I have. And I think we've covered some of the key messages in previous slides. But what I think this really illustrates is the fact that in order to understand education inequalities, we really need to look at these different dimensions, both separately, but also together, in order to get a true sense of the picture of educational inequalities in the UK. So far we've looked at mainly what's been happening pre-pandemic, the trends and the levels of inequalities that we see. What can we now say about the impact that COVID-19 will have on these educational inequalities? So in the Deaton Review, we argue that educational inequalities are determined by differences in various inputs. And by inputs, I mean things like quality of schooling, home learning environment, peers, factors that influence and determine young people's educational attainment. And there are quite large differences in the level of inputs between different groups of young people. So for instance, you can think that a child from a better off family is obviously going to have access to a better home learning environment. Perhaps also they're more likely to attend a higher quality school. And it's those differences in inputs that influence the levels of educational attainment and inequalities in education that we see. And whilst I think it's too early to know the long-term impacts of the pandemic, I think a sensible place to start is by looking at how some of these inputs have been affected by the pandemic. And my focus in the remainder of this presentation will be looking at two specific factors or inputs: the quality of education that young people receive, and also young people's further education choices. Both of these are important inputs to children's eventual level of educational attainment. So let's firstly begin with quality of education. So obviously the pandemic had a deep effect on every part of the education system. The closure of schools and the eventual move to online learning obviously had devastating impacts on all students. On average, initial estimates suggest 1 to 2 months worth of lost learning. However, there were vastly different experiences of home learning, as colleagues at the IFS in a report in 2020 established. While all pupils' learning was disrupted, disadvantaged students were particularly hurt. They were less well prepared to study at home, and also they just spent less time actually learning. And this is evidenced in the following two charts. So this chart shows you access to home learning resources by household income during the first national lockdown. And what you can see is that there's a clear income gradient here. So richer children were more likely to have access to a computer or a tablet. They were more likely to own their own study space, and also they were more likely to have access to active school resources. As well as that, there are gaps in the time spent on educational activities, which is what this chart shows. So this chart shows you children's daily learning times spent on different educational activities. And once again, you can see quite a clear income gradient. In particular, if you focus on things like online classes and other schoolwork, which are the key educational activities here. And particularly if we look at secondary school students, we see massive gaps in the amount of time that students were spending in online classes and other schoolwork, comparing the richest 20% with the poorest 20%. Now, this is just showing daily differences in the hours spent in learning. If you aggregate all of that time up over the pandemic, there's quite a substantial difference in the aggregate amount of time children from different families are spending on educational activities. So all of that is to say that disadvantaged students are likely to have experienced the most lost learning, which is likely to have exacerbated existing educational inequalities. So that's the analysis on the first factor. What about the second factor to consider? So young people's further education choices. Here we're thinking about things like the subjects that young people choose, decisions whether or not to go on to university. All of these decisions impact young people's eventual educational attainment once they reach the age of, say, their mid-20s. Now, a key determinant of young people's further education choices is their prior attainment. So which university you attend, which subjects you study, that all depends on your GCSE and A-level grades. One of the key implications of the pandemic was that exams were replaced by teacher-based assessment, which led to a significant increase in GCSE and A-level grades. Now, a key question here is, were there unequal impacts on different groups of students? Now, I think in the media and in the public, when you ask people, most people will tell you that it was the most advantaged students, the children in independent schools, who benefited most from this move to teacher-based assessment. If you look at the top grades, that does seem to be the case. So this chart shows you the percentage point increase in the number of GCSEs at grade 7 between 2019 and 2021. And you can see that there's a vast increase in the number of grade 7 grades at GCSE, particularly in independent schools and secondary selective schools. You can see a similar sort of trend when you look at A-star grades at A-level. Again, the sharpest increase happened at independent schools and secondary selective schools. So that does seem to suggest that students from wealthier backgrounds seem to benefit from this move to teacher-based assessment. However, that's only looking at part of the grade distribution. If you look at other parts of the grade distribution, we see a different sort of story. So this chart shows you the percentage point increase in the number of GCSEs at grade 4 between 2019 and 2021. And here you see that the sharpest increases actually occurred at sixth form colleges, tertiary colleges. These are the types of schools that were at the bottom of the previous chart. Similarly, the largest increase in pass grades at A level occurred at different types of institutions. So further education establishments, free school meals. Right at the bottom here are independent schools and secondary selective schools. So all of that is because these students from independent schools were more likely to be at the A-star threshold. And so they weren't able to benefit as much from this increase in the pass grades. So just putting that together, this chart shows you the percentage of GCSEs awarded at each grade across school subjects. You can see that there's a significant rise in top grades, but also a significant rise in the lowest grades. And it's the significant rise in these lowest grades which are likely to benefit more disadvantaged students. So from all of that, I'm personally a little unclear as to which students are going to benefit most from this rising grades. I think there's more research to be done here. One important consideration is also the impact this is going to have on future students who will compete in university and in the labour market with these students. So just to summarize, there are long-standing educational inequalities which were salient before the onset of the pandemic. Showing you there were persistent gaps by socioeconomic status. There were also differences by household income, gender, and ethnicity. And crucially, the intersections between those dimensions matters. And what I've highlighted to you is just two of the potential implications of the pandemic. The lost learning, which was particularly acute for disadvantaged students and is likely to exacerbate educational inequalities, but also what's happened to GCSE and A-level results, which is slightly more ambiguous. Let me just finish by saying I think there's a lot of unknowns and a lot of work that remains to be done on the long-term impact of the pandemic on educational inequalities. Thank you for listening, and just a plug for our website as well.
Thank you very much. That was another fascinating presentation and impressive timekeeping from all our speakers. Thank you. It wasn't your fault that we've run out of time. That was the technical hitches at the start. We are at the break. Can I just check, is there any burning question that anyone really needs to ask? Perfect. In which case, could I ask the four speakers to come up and join us on the stage, and we'll take, if we take a couple of questions from our in-person audience first. So would anyone like to kick off? Yes, please.
Hi. I'll make a reference to quality of schooling, which I think was the home learning. Now I just wonder how
I'll just take a couple of questions and then we'll put them forward. Can I ask you just to say your name and affiliation as well? Thank you. And can I have a second question? Yes.
University of Essex. Can you say something about like the historical reasons or whatever for why some places there's lots of school-based providers and some lots of group-based providers? Ivana and Eliza.
Okay, thank you. I'm just going to repeat the questions for the benefit of our online audience. So we've got two questions there. The first for Imran to say something a little bit more on the quality of education and schooling. And then a second question for Ivana and Eliza on historical reasons about the variation in school-based providers and group-based providers. And if I can just ask you to use.
So thank you for the question. So I think the evidence that I touched upon in my presentation, that was looking at home learning, and that was looking at factors like how much time parents spent with their children, the sorts of online provision that schools were providing for their children, and also in addition to that, the delay between the actual lockdown and the beginning of online providers, schools providing online provision. So those were the types of factors that we were considering. In our report, we do actually look at inequalities in usual schooling. So by that I mean in-person schooling. And there we see the key factor seems to be the quality of teaching. That's what's really important for children's, one of the most important factors for children's educational attainment.
I don't know, do you know who wants to take this one?
So on the question of why some areas have, fifth or even more school-based early education childcare settings and others don't, I think it's to do with a very interesting question. It's a lot to do with the faith of the local authority in the market. In some areas, they just don't feel that they will be able to completely deliver or meet the needs of all local families. It was delivered primarily only by private and voluntary providers, and delivering an education in school allows in particular then to control the quality. There needs to be an education in school-based settings. It tends to be graduate-led, and that is associated with higher quality, and also they do cater more children from disadvantaged backgrounds going to school-based settings, including children with additional needs. So it's a way of making sure that these children have access to good quality places. Why in other areas there is more faith that the voluntary sector in particular, or shall we say the private sector, will deliver that.
Okay, thank you. Joshua, have we got any online questions? Maybe you could pick one or two.
The first one is from Jill Featherstone at Factual Research. Hi, Claudine, were you able to produce similar analysis at regional level at all?
Okay, I'll just repeat the question. So a question for Claudine, were you able to repeat your analysis at regional level?
We were, and there were regional differences. I haven't got those figures right in my head, but I'm happy to share them with you. We do have that regional data. My recollection is that there was, I think it was like a 10% percentage point difference for most regions, but with one region in particular, the Southwest, we saw a huge percentage point difference. And we haven't really managed to get our heads around why that might be the case, but it's something we are looking into in more detail, because that is something that's really important. Thank you for the question.
And our second question is from Gemma at NFER. Question for Imran. Did you explore the interaction between income and other characteristics, for example, income and ethnicity?
And just to repeat that question, so question for Imran, did you explore the interactions between income and other characteristics such as ethnicity?
Short answer is yes. Can't remember exactly what we found in that particular interaction. So just looking at those two things separately, you see that children from better off families obviously do better off at school. If ethnicity is actually something that's slightly more interesting, slightly more nuanced, I'd say. So in particular, children from ethnic minorities, you see them do worse early on in their schooling career. They seem to catch up And by the time you reach GCSEs and onto higher education, they're more likely to do well. One interesting thing that we did find, just focusing on ethnicity, is that even conditioning on young people's educational attainment, young people from ethnic minorities were more likely to go on to university. So just if you look at a white British student who has, say, 5 A stars at GCSE and compare that to, for instance, a Pakistani or an Indian child with exactly the same level of attainment, Pakistani or Indian child is significantly more likely to go on to university.
Thank you. You can keep it. Tina.
Thank you very much for all those presentations. I've got 2 questions here. One, listening to the talk, are we thinking maybe about a short, sharp for various groups and year groups of children that we can affect? What we so the ministry here policy in longer term impacts and challenges to educational right as well. But similarly, someone who has that what are some of the lessons we can learn to take forward, some of the positive transformations?
Okay, thank you. So these questions I think could go to any of our 4 speakers today. The 2 questions are, we've talked about short, sharp shocks for various year groups. What do you think the longer term challenges for education providers are? And then what about the lessons or positive reflections on the future in the longer term?
I can start with that question. I'm sure people have things they want to share. From a sort of reception and Key Stage 1 perspective, we are doing a longitudinal study at the moment, which will run for 3 years. So that's something we are very keen to monitor, because, as I said earlier, some groups of children may have less opportunities to recover lost learning or developmental skills that they haven't yet developed, and that might then impact on their future outcomes. And we know from our data that we're collecting at the moment that, as I said earlier, we have children in reception year 1 and year 2, and we have year 2 teachers saying that children are almost sort of developmentally where they would expect them to have been in year 1 or in reception. And that's particularly the case for things like physical development, and that's having knock-on effects on handwriting, for example. So I think it's clear that question, we don't yet know what the answer to that question is, but the implications are that yes, for some children particularly, there could be long-term effects. I don't know about children at the older end of the schooling system. I think other people have more experience of that. And I think as I was saying earlier, one of the challenges is that teachers are expected to reach performance standards from pre-COVID times, and yet that's not recognising the significant disruption to children's development and the impact that might have had. And as I said earlier, that's not suggesting that we reduce our ambitions for our children, but we might need to think about different ways of supporting children to reach those levels that are expected of them, and maybe even adjusting our expectations in a way that allows them to fulfill their potential in different ways, and just being cognizant of all the disruption that they've had. There have been some benefits, though, in terms of what schools have told us. So some of the things that schools put in place over the lockdowns, for example, they're keeping in place because they're finding that for hard to reach families, for example, having online assemblies, having online parents' evenings is allowing not just hard to reach families, but also working families to engage more with the schools and to to have a good school teacher relationship. So those are just some of the observations we've made.
I mean, from our study, the key lesson is the widening inequality in the take-up of early education childcare. I mean, we haven't got a crystal ball, so what we have is the state of play at the end of 2021. But regardless of that, there was inequality before, so the need to act there is now, we need to do it. I mean, and also the take-up of the early education among the advantaged 2-year-olds had been declining even before the pandemic. A huge variation. There are some areas where only 20% of 2-year-olds take up a place. And even when it comes to 3- and 4-year-olds, we've got places like London where the take up is just over 80%, which means nearly a fifth of children don't get any early education before they start school. So regardless of whether even figures go back to normal, normal wasn't good enough anyway. And to us, the key lesson has been how well early education providers and local authorities work together during the pandemic. They have to overcome some really big challenges and creativity, commitment, and joint working. They did quite well, and they need to be continued to be supported to do that. But what we are saying with commitment and working very long hours, that is not enough. They need some funding, which is clearly linked to some policy objectives around quality and equity of that.
Maybe I can touch on something slightly different. So as an economist, I'm quite interested in the labour market effects that this is going to have. So when these young people enter the labour market, I don't know, in 4 or 5 years, what impact is that going to have? So as an economist, we usually think that education has 2 functions. Firstly, the actual learning from education, building skills and skills that are going to be useful in the labour market. And the second function is the signal that your education provides to future employers. So the fact that you've got so many A stars, you've got maybe a first in your degree, what signal that sends to your employer. And what the pandemic has done is it's shifted and affected both of those margins. So from this first perspective, we've seen a loss of learning, which is going to impact all of the students who have been through the pandemic, and also university students as well. So it's going to be interesting to see how that plays out in the labour market in years to come. And the second function, the signalling role of education, it's also going to be interesting to see how employers look at people's qualifications in the future. Will they discount the qualifications that young people are currently gaining because they gain those qualifications during the pandemic? And how will that play out? How will the relative differences in qualifications and attainment affect the labour market outcomes of young people?
Great, thank you very much. I think we've had our extra 15 minutes now. So can I just say a thank you again to the 4 speakers for the session today. And we're just going to hand over to Sue to explain what's going to happen next.
Great. Thanks very much, Miranda, and thank you again to all our speakers for a really fascinating set of papers. Okay, well, we've now got, I assume still we have 15 minutes, yes? So we've now got a 15-minute break. So if you'd like to make your way downstairs where there are some refreshments available. And then after the break, we've got another parallel session. So some papers in here and some over the road, and we'll round you up at the appropriate moment and send you in the right direction. So please, please go and have a drink or something.
Time to start 10:12.
10:12, right. Thank you. 10:12 then, we'll be back here.
So I have a slightly different kind of topic. So it is about attainment, but I really want to talk about going beyond some kind of the orthodox concepts of success for young people that we consider. Going to figure out which way to move these on. Several different ways. There we are. Right. Okay. Okay, so I think what we typically think of as success for young people is really defined by some of these concepts around meritocracy and human capital, right? So we think that success for a young person is to stay in school, attend university, get a good graduate, well-paid job. But actually that kind of success excludes many young people, and creating it as the success creates a group of failures who can end up seeing academic work as negative if they're not able to do it, or they're really struggling, or they don't enjoy it. So my argument really, as we go through, is that measuring success based on different kinds of measures, different kinds of concepts that focus really on subjective well-being. So do we want people who meet a particular group, or do we want people to be healthy and happy? And actually maybe that is better. Okay, so in terms of the orthodox measures of success that I'm going to use, as Rebecca said, I'm a PhD's in the economics of education, so there's lots of measures. So we can look at the expectations of young people. So do they, and their aspirations, age 13, 14, do they want to apply to university? Do they want to stay in full-time education? And then in terms of outcomes, being in employment, earning a relatively high wage. Okay, so these are what we consider orthodox measures of success, what we would all recognise as kind of normal, I suppose. But who says that? So this kind of exists within society, it exists within economists, and it exists within politicians. We don't have to go very far back to think about times when actually many people didn't go to university at 18. Some people did all kinds of different things at different ages. But Blair's target of 50% of young people into higher education was a clear kind of marker, the focus on education. Ed Miliband's concept of the forgotten 50%. Who wants to be in the forgotten 50%? It doesn't sound like an inviting prospect, doesn't it? And we've had economists over the years, there's a big focus on more education means more wealth. We invest in education and focus on income returns to qualification. So many of the studies of attainment look at the income returns to qualifications. We all know that different types of jobs don't necessarily pay what society thinks it pays what society thinks those jobs is worth, but do we value a banker higher than a nurse? In society, you know, very recently, someone from Love Island saying we all have the same 24 hours in the day. Obviously, that's just not true. The Millennium Cohort study, we know that parents expect and that young people have those high ambitions. From the Office of the Children's Commission this morning, 97% of parents of children aged 7 want them to go to university. Okay, well, that all sounds great. We want more people to go into higher education. I suspect we all believe in learning, that it's a good thing, regardless of your income returns. But what's the problem? Well, actually, we live in a society, and I think we all know that we live in the society where those people with more wealth and more education can hoard those things and pass them on to their children. And Piketty's book, Capital, focused on that in terms of inequality. But we can see even from some of the data from UCAS that, you know, young people from higher socioeconomic backgrounds are more likely to go to university. If we just, I mean, even going back to Michael Young and, you know, his book on meritocracy in 1958, we're creating those kind of angry failures, which arguably leads to these two groups in society who really don't understand each other. You know, there's a lot about kind of populism and the focus on not understanding other people, and, you know, to call people a kind of basket of deplorables. We might not like people, we might not understand them, but are we, you know, is insulting them helpful? So what would those new measures of success look like if we were to create them? So self-determination theory argues that for subjective well-being, you need 3 things: autonomy, competence, and relatedness. If you have all of those things, then broadly you have better subjective well-being. So how can we measure some of those things? And I'll talk about the data in just a second. But I've argued that you can measure autonomy by thinking about your future, having a future plan, wanting to be self-employed or have your own business rather than focusing solely on someone employing you, and then feeling like an adult. In terms of competence, there's an argument around doing something that you enjoy rather than something that you think necessarily will get you a job, and being self-employed yourself. Unfortunately, we don't have a lot of data on relatedness that I could use in this particular study. But I've also been able to look at good mental health because the general health questionnaire is included, and that gives a sense of overall well-being. So the data that I've used is LISPE, the longitudinal study of young people in England, otherwise called Next Steps. So this cohort of young people were born in 1989-90. So that means that we can look at them at both So I've used wave 1 and wave 8. Wave 8 came out in 2015 or was surveyed in 2015. So their kind of aspirations and expectations when they're 13, 14, and then their achievements when they're age 25. This is different in some of the data because we're able to test both those kind of income activity measures that you can see people doing in terms of income returns to qualifications, but you can also test attitudinal measures. And there's an equation for you for people that like equations. What that means is that I've got some confounding factors in the data. So some of them are fairly standard in terms of gender, class, background, and ethnicity. A bit more detail about those there. But the key thing that I've done, because my kind of interest really in those is those young people with different levels of qualification, is created kind of 2 groups. So I've got the academic group, who are young people who achieve an academic level 3 or higher by age 24. I've used age 24 because that is the marker in the wave 8 data. At the time that I was doing this, for those of you familiar with the data set, I didn't have access to the matched data set, although it is matched. So that's on the cards to do. The data is actually from the MPD. So although it says by age 24, it's probably by age 16, because that's when you kind of stop being at school. So what does that mean? Okay, so your orthodox expectations and aspirations. So we're looking at age 13, 14. Do young people plan to apply to university, and kind of do they have a plan for staying in full-time education? Now, what you can see is that the applied group are significantly less likely to have these orthodox aspirations and expectations. So even at 13, 14, they do not have the same aspirations as those who later go on to get higher level qualifications. So these are all significant. That's your p-value down there. So this is what we would expect to happen. But it really, if they're so much less likely to want to do these things, why are we telling them that they should? And if you look some of the, so I've done some interactions around class and gender in particular. Ethnicity is difficult because I just don't quite have the numbers. But in terms of the class interaction, as I've highlighted here, what this basically means is that compared to kind of the lowest classes, if you like, I've kind of categorized them into the 8 O&S categories. Those in the highest class are so much more like significantly and really, really significantly more likely to want to do all of these things, so much that I even changed the base on the bottom to test it again. And it's still incredibly significant. So what actually we're telling people in terms of these orthodox expectations and aspirations is what the highest class of young people want to do. But what about the heterodox, what I've called heterodox aspirations? So these are my subjective well-being aspirations. All right, so you want a bit of autonomy, you want to be your own boss. You have a future plan, so you kind of slightly torturous, I'm afraid, with a double negative, but these young people essentially with the 0.72, that means they're disagreeing with the statement, are just, they're significantly more likely to disagree with that statement. So they're making a plan. And in the middle, it's more important to do something that I enjoy. So what's notable here is that the applied group, so the young people who later achieve level 2 qualifications, academics, so they get their GCSEs and then they stop, basically. They typically do vocational qualifications afterwards. They are significantly more likely to want to be their own boss. Okay, you might expect that. They're significantly less likely to just wait and see where they end up. So they want to have a plan. They're thinking about it properly. And they are significantly more likely, and I find this a bit sad actually, significantly more likely to want to do something that they enjoy rather than something which will help them get a job later. So the academic young people are deliberately kind of wanting to do something which will help them get a job later rather than something that they enjoy, even at age 13, 14. Okay, so the gender interaction on this is particularly, I've kind of marked it in bold, is to identify the male difference. So in terms of being self-employed, we know that boys do less well at school. Is there's something in this kind of autonomy, wanting something different from what is what is expected. Okay, so orthodox expectations, age 25. This is again what you would expect. So we're looking at to be part of a household with the highest of 3 income bands. So the thing with total household that's in here is that it's basically if you're living with a partner, but if you're still living with your parents age 25, it doesn't count your parents. It just counts you or your partner if you're living with them. To have above average income, there were loads of income bands in the data. So I've created kind of 3 above average, average, below average using ASH from this year for this group of young people age 25. Okay, so my academic group, as you would expect, are some kind of vice versa. The applied group is significantly less likely to have a high income and to be an employee versus being self-employed, studying, or being neat, as you would expect. But again, we've got a class interaction, particularly on income, where actually the significance is coming from the income. So this is what we're telling young people they should achieve. They really should go out and get those really high wage jobs. Actually, it's those from the greatest classes that are doing that, which we know. But what about the heterodox achievements? Okay, so you've got good mental health. So this one, the group who only got level 2 qualifications, they've only got GCSEs, and they might have other vocational qualifications. They have significantly better mental health than the group of young people who got level 3 or higher qualifications by age 24, and who are significantly more likely to have gone to university. So at age 25, there's something very different about this group. They're also significantly more likely to be self-employed, and that's very, very significant. And they're more likely to consider themselves to be an adult and consider themselves to be fully mature. So there's something about this group that by 25, they're a bit more grown up. They probably spent more time in the workplace. They have better mental health, and they're more likely to be self-employed. So I did a class interaction for this one as well. And you can see some of the differences that I've highlighted here. This one's quite interesting. The class interaction, those from highest classes are significantly less likely to consider themselves to be fully mature at 25. I don't know what that tells us, but there's something interesting in that. And then the self-employment is, kind of really sticks out. But what it more generally shows is that actually there's not much of a relationship between a class and heterodox achievements in the way that there was a significant relationship, or there was a kind of clear relationship between class in the orthodox achievements. Okay, so what is all of this telling us, and why am I telling you? Well, at age 13, 14, those in the applied group, so those with those kind of level 2 academic qualifications, have completely different aspirations and expectations. They're significantly more likely to want to study something they enjoy rather than something which will help them get a job. They want to have their own business, and they're more likely to have a plan for their future. At 25, they've achieved those things. They've got better mental health, they feel more adult, they're more likely to have achieved their goal of being self-employed. So arguably they've met their own aspirations and have better subjective well-being. But society tells them that they failed because they haven't been to university, because we focused on that. And then later for not being an employee and not being a higher earner. So if we could redefine success, if we could create different aspirations and expectations that already exist amongst these young people, but that we should consider to not just be acceptable, but something to celebrate. And then to celebrate some of the things that they're doing later on. Doesn't mean you're never going to do any higher learning. It doesn't mean, you're just going to kind of stop learning. Many of us have kind of gone back into education at different ages. And I think that's incredibly positive. I think you get something very different about education at different ages. But I think there is something about trying to stop that kind of resentment from those who don't fit those orthodox definitions of success, and stop that sense of entitlement by those who do fit it. And that's me.
Thank you so much, Charlene, for really thought-provoking presentation. Hopefully we'll have some time for questions later.
Next up is Svetlana Spate, one of my colleagues and another research director at the Center for Children and Families. She's going to talk to us about SEED, the study of early education and development funded by the Department for Education. Over to you, Svetlana.
And I've got my co-author here on the title page, Isabel Taylor. She did quite a bit of analysis that I will be presenting. Oh, it's not moving. Oh, it's moving now. Cool. So I think I've said this already. So this is a diagram from our SEED study website, the bottom part of it. So we started in 2013, and our children whom we are following, it's a longitudinal study. They were born between September 2010 and August 2012. They were 2 years old when we started following them up. At wave 1, our sample size at baseline was just under 6,000 completed interviews, and we're going to follow them up all the way to key stage 4. We are doing research with parents, with children. When children were 3 years old, we did research with the childcare workers who were looking after them. We've done a couple of data collections with the teachers about our children as well. And we've done the study in collaboration with partners, academic and non-academic partners. So the original research question for the SEED study was about the funded hours that were just rolled out in England for disadvantaged 2-year-olds. So the first question that we tried to answer at the time was, did the new funded provision for disadvantaged 2-year-olds increase take-up of early childhood education and care? However, as the study progressed, there were more and more research aims added to it. What's the impact of ECIC, and including amount of childcare they received, type of childcare, type of provider they went to, quality of provision that they received preschool, what's the impact on child outcomes? And we looked at cognitive outcomes, social emotional outcomes, and attainment. And that's from age 3 to age 16. What's the value for money and cost benefit outcomes of ECIC usage? What's the quality of provision in England? Our collaborator from University of Oxford, Ted Mellish, he led on the study of quality of provision, which is very interesting in its own right. And what's the impact of home environment on child outcomes? We've published 16 research reports so far, and they are available on our study website or on the government website. So I'm going to say a few words about what we did during the COVID-19 pandemic. We've done 2 follow-ups with our families. I'm going to present results of the first follow-up. That report has been published. The second follow-up that we did during school closures, the results are being analyzed by DFE themselves, and they haven't published them yet. So our first COVID follow-up was the wave 5, where we've had 6 waves so far, and we are currently doing wave 7. So this is the wave 5 of our study. Field work was in September, October 2020. It was a survey of parents only. We didn't collect any data from children directly at that point. It was an online telephone survey, so parents had the choice whether to complete the survey online or on the telephone, and we achieved a 50% response rate. And our children, at the time of that survey, they were between 8 and 10 years old. They were in year 4 or year 5 at school. So what did we find out about school attendance? We asked them about the first lockdown. We asked them about the period between Easter holidays and May half term 2020, so April, May 2020. We found that in that time period, 89% of children did not attend school in person at all. After May half term, you might remember that some year groups have been invited back to school. That was specifically nursery, reception, and year 6s. Because our children were year 4 and 5, they were not really those children who were invited back, but we do find that it's a small proportion of children who did not attend school in that time period, so 74 rather than 89. And at this point, we are starting to see link with disadvantaged. More disadvantaged children were more likely to be out of school than less disadvantaged children. If you remember, there were various criteria for children to be able to go to school in those time periods. You had to have a key worker parent and so on, so it might be linked with that. Then in autumn 2020, at the time of the survey, 95% of children were back at school. However, not everyone was back, and some other speakers have already mentioned this. Not everyone went back. That was the same for early education childcare, and we can see the same for our year 4 and 5 children. So we found that 7% of the most disadvantaged children were not attending school in September, October 2020. And this compares with 2% of the least disadvantaged children. So it's quite a large difference. We also found a large difference by special education needs. 8% of children with special education needs were not attending in-person school in September, October, compared to 3% of children without SEN. We asked a few questions about homeschooling. In the first lockdown, we found differences by disadvantage that is consistent with what other people have been reporting. So children from more disadvantaged backgrounds had they were less likely to have access to a computer, and that's any access, not necessarily exclusive access. We also found quite large differences by special education needs. This was in relation to having access to digital technology, but also in terms of school setting work and children completing work. Children with special education needs were less likely to actually engage in home learning. But what I really wanted to tell you about is social emotional development of children. Because we've got a longitudinal study, we were able to compare children's SDQ scores when they were 4 years old from one of our previous waves of SEED, and their scores at the time of the COVID follow-up. We focused on 3 scales. Specifically, we focused on conduct difficulties, emotional difficulties, and hyperactivity difficulties. We didn't look at peer problems, but we also looked at the total difficulty score. What do we know about SDQ scores? Well, I'm just going to assume that most people will be familiar with the strength and difficulties questionnaires. So generally, we found, and other people have found, that as children grow older, the level of difficulties, social emotional difficulties they experience, it does go up. So you can see, for example, here that the total difficulties at age 4 was 8.1, but at age 8 to 10 was 10. So it goes up. It has gone up for also emotional and hyperactivity difficulties specifically. So this is nothing new. We also know that there are difficulties by disadvantage. Children from more disadvantaged backgrounds are more likely to experience those difficulties. And we found that those difficulties persisted. So we saw them already at age 4, and we still see them at age 8 to 10. However, what we also found is that difficulties by special education needs, which were already there, they widened. So we already had a pattern that children with special education needs were more likely to have difficulties, but they were even more likely to have difficulties during this pandemic wave. These are coefficients from fixed effects models that my colleague Isabel Taylor ran, and this shows that even after controlling for a number of things, and here we control for social demographics, for attainment, for families' experiences during the pandemic, for early years experiences in the family, and we still find that children with special education needs were experiencing greater, higher increases in 3 out of 4 difficulty scores compared with children without special education needs. We also looked specifically at parents and what was happening with parents in the family, and we found that parents themselves were experiencing quite a lot of mental distress. So on this graph, you can see the proportions of parents in wave 2 and wave 5 who had no distress, moderate distress, or strong distress, according to Kessler 6. And you can see that the proportion of parents with no distress is much lower during the pandemic wave, and parents with higher, moderate, or strong distress, those proportions are a lot higher, which is not surprising. But what is the effect on the children? So what we have done, we created a measure which takes into account what we know about parental distress when children were 3 years old, I think. That's right. Yeah. And then during the pandemic. And we created this categorical variable. We've got long-term distress. Parents were in distress in the previous wave and then the current wave. Recent distress means they were all right before, but now they're not all right. 30% of parents were in this category. early years distress only, and then no distress. So about half of our parents didn't have any distress. And the no distress becomes the reference category for multivariate analysis. So in this graph, you can see the coefficients from the modeling. And you can see here that recent parental mental distress was associated with greater increases in social emotional difficulties. So what we're trying to model here is not, so all the children on average experienced increases in social emotional difficulties, but which groups experienced greater increases and which groups experienced not such pronounced increases. And here we show that if the parents were distressed during the data collection, so during the pandemic, then children were more likely to experience greater increases in difficulties. We also looked at academic attainment. I really like this bit of the analysis because very often we think of attainment as our final outcome. So what affects attainment? Social emotional factors affect attainment, but here we look that way around. Your previous educational attainment and how well you did during your early years foundation stage and during your key stage 1 assessments, is that linked at all with social emotional development? And we have 4 categories here. So we've got linked NPD data, and we created 4 categories. We've got long-term high attainment, that means they achieved required level in both assessments. We've got a recent low attainment, so they used to achieve the required level, but at key stage 1, they didn't achieve it. So key stage 1 was still before the pandemic. Early years low attainment, but then they got better, and long-term low attainment, they didn't do well in the beginning, and then at the earliest foundation stage and at key stage 1. And in the report we have a table that shows you all different percentages for SDQs for these 4 groups, and they show you what you would expect. If children didn't do very well academically, they also have the highest scores for SDQ difficulties, but that's not what we wanted to know. We wanted to know whether there was a link with the changes in social emotional scores. And we found that there was a link. So our reference category is children who met required levels, both at earliest foundation stage and in key stage 1. And we found that compared to those children, there were greater increases in social emotional difficulties amongst children whose academic attainment had deteriorated between early years, foundation stage, and key stage 1. So if they experience that deterioration in their academic attainment, we later on also see that they experienced a greater deterioration of social emotional outcome. So they kind of go hand in hand. And just a few words on what's happening on SID right now, what are we doing? We are in the middle of doing field work for wave 7. So as I said, wave 6 was also a pandemic wave, another webcast survey that we did it a few months after the first one. But currently we're collecting data again, face-to-face. We're doing a survey of parents. We're doing cognitive assessments with children directly. And for the first time, we're doing a survey with children. So the children are answering their own 15-minute long questionnaire, the self-completion audio-supported questionnaire. We're aiming to achieve over 2,500 interviews. This is the top part of the flower that we have on the website that shows you that we have 2 academic years. We've got children currently who are in year 6, and they are the ones that we're doing the survey with. And we have the other half who are currently in year 5. So we're going to do a survey with these children next year. So the flower shows you that. And we're also doing survey of teachers. We collect from parents information about where the child goes to, the name of the teacher, then we contact teachers. We've piloted this instrument, got excellent response rates, but we haven't started the main stage survey of teachers yet. We will be linking data with National Pupil Database, and we will be publishing reports. There will be an impact report published and the value for money report published both in 2024. And just to say, we do have our partners we work with. So we used to work with the University of Oxford and Frontier Economics and Action for Children. And we are currently working with SQW who are doing the value for money work, and also with academics from Bristol, UCL, and Durham who help us develop instruments. And I think that's it. And I hope I was able to 15 minutes. Thank you.
Thank you so much, Seta. That was a whistle-stop tour and really interesting, but I'm biased because I've also worked on seeds, so always excited to hear more about it. Our next, we'll switch around the order slightly and see if in the meantime we can figure out how we can actually hear Helen. So instead we're going to hear from Bao-Wen Su. Thank you so much for jumping in a bit earlier than expected, which is great. Let me just find what I was going to say about you. So Bao-Wen is a research associate in the Department for Epidemiology and Public Health at UCL. And she is going to talk to us about young carers. So thank you so much for being very flexible, and we're looking forward to your presentation.
Thank you, Rebecca. And thank you, everyone. So I'm going to draw your attention to young adult cares, and I'm going to talk about does providing informal care in young adulthood can impact their educational attainment. So this is part of the project called EuroCare. So EuroCare is a consortium of researchers from the UK, Germany, Norway, and Spain. And the aim of EuroCare is to investigate the inequalities in education, employment, social participation, and health, as well as the gender, socioeconomic, and ethnic differences in these outcomes across European countries. We are adopting a life course perspective using longitudinal data to focus on the consequences of young adults who are providing informal care, alongside those providing care in mid and later life. So here are our teams. So the focus of today is to answer 3 questions. So first, who are young adult carers in the UK? And second, how much do they care? And the last, do young adult carers have reduced educational attainment compared to their peers who are not carers? So the definition of young adult carers has been formally conceptualized by Becker and Becker 2008. So they define people aged 18 to 24 who provide or intend to provide care, assistance, or support to another family member on an unpaid basis. And since then, the term of young adult carers has been used more widely in the literature. However, different age ranges have been used for identifying a care as a young adult care. So here we consider young adult carers to be young adults aged 16 to 29, because this age range reflects the fact that young adulthood as a life course period, they have been extended in the past few decades. So why we are interested in young adult carers? Young adult caring occurring at a time when young people are seeking to complete compulsory education and establish themselves in the job market. So young adult caring may have both immediate and longer term effects, given the key transitions generally made in this life stage. While many other students are embracing
shows me top 9 presenters.
Okay, thank you. So we are here. So we are talking about young adult care. So while many other students, they are embracing a very active social life, we know that young adult carers, they are juggling academia demands and also caring responsibilities. For example, caring can reduce their time to complete assignment, participation in group activities, and also reduce their time for prepare for exams. And also planning or thinking about family members' specialized care needs, or worrying about the health conditions of their loved ones are potentially burdensome and exhausting. And more importantly, leaving home for education is especially problematic for many young adult carers if they are the primary carers or their loved one is not provided with appropriate care while they are away. However, in the literature, there's only a small body of literature has assessed the influence of young adult caring on education attainment. And the current available evidence is either qualitative or cross-sectional using small sample size. So we aim to use a large longitudinal data. So the UK Household Longitudinal Study, the UKHLS, is also known as this Understanding Society. So it's a household panel study started from 2009 and is nationally representative of UK households. So all adults aged 16 and plus have been interviewed annually, and so far there are 11 waves available. So they have several measures of caring in the UKHLS. They have this binary yes and no caring, and this yes and no caring has been asked for inside household care and outside household care separately. And additionally, like weekly hours spending on caring, and also the number of people caring for, as well as the relationship to each care recipient, as well as the place of care has been asked. And also based on this binary yes and no caring, we have generated their age of care onset, as well as the duration of care. So we first did a cross-sectional description to see how the percentage of young adult care is changing over time. So this red line is the percentage of care. So if you look into the percentage here, about 9% of young adults are providing care, and this percentage is quite stable across all the waves. And then if you look into the place of care, so orange is inside household, yellow is outside, and green is combined both inside and outside. So we can see that most of young adults, they are providing care outside household. And then in terms of the longitudinal analysis, we're pulling the data from all waves from wave 1 to wave 10. We didn't use wave 11 because wave 11 was conducted during the COVID time, so the nature of caring may be slightly different. That's why we decided to use just the first 10 waves. So we include everyone who were between age 16 to 29. So we define carers as those who provide care in any of these waves, and non-care as those who never provide care in any of these waves. Our outcome is their highest educational qualification across all waves, and then we economize our outcome into higher degree versus no degree. And for the sample, we have to exclude those who were younger than age 21 because they were too young to have finished a university degree. And this gave us a sample size nearly about 19,000, which is quite good. And then we use logistic regression models separately for each aspect of caring and to see how that influenced their chance of achieving degree. So first, we look at who are young adult carers, and this graph shows the percentage of providing care by several socioeconomic characteristics. If you look at the left-hand side, so women, they are more likely to be young adult carers than men. And in terms of ethnicity, so those carers, they are more likely to be Bangladeshi or they are more likely to be Bangladeshi or Pakistani. And also carers, they are more likely to come from a more socioeconomic disadvantaged household, including lower parental occupational class, lower parental educational qualification, and also lower household income. And then we look into these caring characteristics among carers only. So in terms of the duration of care, which is on the left-hand side, more than half of them only care for just 1 year. About 20% care for 2 years. Very few of them are providing much longer term of care. And in terms of the weekly hours spent caring, so nearly half of them, they only care for 4 hours or less. And then 20% are caring for 5 to 9 hours per week. And a fewer were providing more intensive care. And looking at the number of people caring for, 90% of them only care for one person. And for the place of care, there are more outside household care than inside household care. And for the recipient of care, most of them are caring for their parents. And following that is caring for their grandparents. So here are the results from the logistic regression, and we have adjusted for a number of confounders. So the results are shown in odds ratios with the reference category are the non-carers. So basically lower value of odds ratio means lower likelihood of obtaining a university degree. So if you look at this on the left-hand side, this orange bar, so yes care, their odds ratio is a 0.6. So this means that carers, they are 40% less likely to obtain a university degree. And in terms of the duration of care, we see that as the duration increased, the chance of getting a degree slightly decreased. However, when we look into the weekly hours of care, which is in purple, we see a very clear pattern that so more weekly hours of care, the lower chance of getting a degree. And the same was found for the number of people caring. So basically, the more people you are caring for, the less likely to get a degree. And for the place of care, we find that so inside household care is associated with lower chance getting a degree than outside household care. And this is mainly because inside household care, they have more weekly hours, so it's more intense. And once we adjust for these weekly hours, actually, we didn't find any difference between the place of care. And in terms of the age of care, it's interesting to see that. So we find that those start care at age 18 or 19, they are the least likely to get a university degree. So we know that age 18 or 19 is the really key timing with most students making these transitions into higher education. So it seems that providing care at this key point may have a stronger impact on them. And in terms of the recipient of care, it seems that caring for grandparent is less of a problem than caring for a parent or anyone else. And we tested several interactions, and we didn't find any interactions with gender, ethnicity, or socioeconomic status. We also did several sensitivity analyses, and one of the sensitivity analysis, we call it the quasi-cohort analysis. So because the problem of this household panel study is that so people can enter this age range at different ways. They also live at this age range at different ways. So that's why now what we did is we only include people who we can observe from age 16 and all the way through age 23 to make sure that they have this equal length of time at risk. And we find quite consistent results as our main analysis. So just to summarize, we find that so young adults who provide care before age 30 were less likely to obtain a university degree compared to their peers who did not provide care. And we find that the number of hours caring per week and the age of caring were crucial determinants of education. So weekly hours spent caring are negatively associated with the likelihood of obtaining a degree qualification. And the caring at age 18 or 19 may have a stronger impact on obtaining a university degree than caring at other ages. So the policy implication is that so it's quite important to support the needs of young adults who are providing informal care while making the key life course transitions, particularly for those who are shouldering high intensity care. And the preprint of our paper is available, and here is the link. And if you got any questions, feel free to contact me, and this is my email address. Thank you.
Thank you so much, Bo. And that was a really fascinating presentation. And we have come to our last speaker, and we're going to try again to connect with her, and hopefully we're a bit more successful this time. Beginning, you can press, I think, at the top.
So that one. Okay. Yeah.
Right.
So can you hear me and see the screen?
Yes.
Brilliant. Thank you very much. And good morning from the US. It's morning here, quite early. But thank you very much for allowing me to present my work to this conference today. And I'm really sorry I couldn't be there in person. It looks like a really great event. So today I'm going to be focusing on my research that kind of looks at the impact of the home environment, but specifically the impact of fathers. And I'll be talking about whether fathers' childcare involvement affects children's educational attainment in the first year of primary school in England at age 5. So this is what I'm going to cover in the next 15 minutes, just providing a bit of background context, going through my research questions, going through the data that I use, some of the results, and summarising the kind of key headline findings. So what's the issue? So we know that fathers' childcare involvement, we know that fathers spend more time on childcare than previous generations of fathers did, but the implications on children are unclear. So of course we believe it's likely that fathers' childcare involvement from a loving, caring father is going to have a positive effect on children's educational development, but the empirical evidence to support this is quite limited. So this is where our research comes in. The aim of our work is to explore whether and how fathers' childcare involvement influences their children's educational attainment in primary school in England. So just to say that the analysis that I'm presenting today is part of a much larger 2-year funded project by the ESRC Secondary Data Analysis Initiative. I'm leading the project, and my team of co-Is and researchers are on the slide there. So we also have Jeremy Davis from the Fatherhood Institute, which, for those of you who don't know, is a charity think tank organisation that supports and advocates for involved fatherhood in the UK. Also co-Is from Manchester and Leeds as well. And our project website is there, so please do have a look if this is of interest. So what do we already know about how fathers' involvement might affect children's outcomes? Well, research shows that parents' childcare involvement is critical for supporting children's development, but this is a conclusion largely drawn from research conducted with mothers or from parents more generally. And this body of work finds that engagement in educational or structured types of activities with the child, like reading, playing sports, going to the park, doing arts and crafts, that has an association with better primary school grades and cognitive skills, as opposed to engagement in unstructured activities like watching the television. But there's little evidence to show whether and how fathers impact on their children's education independent of mothers, and whether fathers' involvement is particularly important for boys, girls, or at certain stages of the child's life, regardless of gender. It could be that paternal childcare involvement has different consequences for children's development by, for example, supporting progression in particular academic subjects, helping to close gender gaps in attainment, or moderating the known detrimental effects of poverty. Now, while the analysis I present today doesn't address all of these things, these are things that we are looking at in the broader kind of peace project. So why is this important? Well, some of the reasons for why this is important are shown on the slide there. I'm not going to go through everything now. I'm sure we're kind of aware of some of these things here. But I think most notably there is that the Department for Education in 2018 themselves reported that over a quarter of children in England were not primary school ready because they fell below the expected grades for communication and literacy. And this is a statistic that has been exacerbated during the pandemic. And also, I think quite striking there, the UK is ranked in the bottom third of 41 of the world's richest countries for inequalities in primary school education, according to UNICEF. So while our broader project is exploring attainment at different ages through primary school, for the paper I'm presenting today, the focus is just on attainment at age 5. And the two sort of main questions guiding this analysis are, we're looking at what is the relationship between fathers and mothers, as we're looking at mothers as well, childcare involvement and children's attainment during the first year of primary school at age 5, and how far is that relationship mediated by the child themselves, by the child's behaviour, because obviously they're going to have some impact on this as well. So the data that we are using is from the Millennium Cohort Study. This is a nationally, I'm sure a lot of you already know, it's a nationally representative birth cohort study following about 18,000 babies aged 9 months who were born around the year 2000. So for the overall piece project, we are using all 5 sweeps of data from preschool up to age 11. And we're linking this to the Early Years Foundation Stage Profile, but also the National People Database as well. But for the analysis that I present today, I'm just going to be drawing on Sweep 3, focusing on attainment in the Early Years Foundation Stage Profile at age 5. So our sample for this analysis is just under 5,000 two-parent, mother-father households in England, and the method that we use is mediation analysis, which I will talk about now. So for those of you who are not as familiar with what a mediation analysis is, this kind of just basically illustrates what it does. So we have our predictor variable, which in this case is involvement, fathers and mothers' involvement. We use that to predict an outcome, which in this case is attainment, but we're also exploring whether that relationship is mediated or explained by a third mediator variable, which is the child's behaviour. So I'm going to give you a bit of information about each of these 3 variables before presenting the results of the model. So because this method is a structural equation model, we first run a confirmatory factor analysis to derive latent measures of fathers and mothers' involvement. And they're called latent measures because they're not directly observed, but they rather capture the common variance that is shared amongst the set of observed variables that measure how often a father or mother does the childcare activities listed on the slide there, things like reading, drawing, taking the child to the park and so on. So in more simplistic terms, for those who are not as familiar with the quant side of things, you can think of the involvement measures as kind of like composite measures that capture all those different activities on that slide. So we have one for the mothers, one for the fathers. So the dependent variable, which is the variable we're predicting, is attainment in the Early Years Foundation Stage Profile at age 5. And I'm sure, I know Lana's already spoken about this, we are aware of it, but I'll just show you anyway. It's, of course, a standard assessment for all children at age 5 at the start of primary education in England. And it captures the early learning goals as a set of 13 assessment scales shown in the right column there, which map across 6 broad areas of learning. So for those of you who aren't as familiar, for each assessment scale, the teacher gives the child between 1 to 9 points. So if you add all the assessment scales together, we get a continuous overall achievement scale of between 0 and 117 points. But for our analysis, we generated a latent factor of attainment using the 13 assessment scales or variables shown in the table there. So our measure is a latent composite measure of attainment that captures all these different areas. And then finally, again, Svetlana's already spoken about the strengths and difficulties questionnaire, but this is our mediator variable, and child behaviour here is measured by the Strengths and Difficulties Questionnaire, which, as we know, is a widely used measure of children's emotional and behavioural problems. and we're using all 5 domains there, but for this model, we're just using the observed measures of behaviour as 5 composite measures. So we've got emotion, conduct, hyperactivity, peer problems, pro-social behaviour. So this is what the statistical model looks like. And this is a really powerful model because it allows us to account for the network or system of relationships that work together to affect an outcome variable. So in this case, attainment. And this really sort of illustrates what our model is doing. So if you think of all the single-headed arrows as representing a regression model, so we have father and mother involvement, which is our latent composite measures. They're predicting all the measures of the child's behaviour. All the measures of the child's behaviour are predicting attainment at age 5, but the model also looks at the direct effects of fathers and mothers' involvement shown by this arrow here. And this double-headed arrow here shows that there is correlation. We're sort of measuring the correlation between fathers and mothers' involvement. And the beauty with this sort of model is that everything is estimated at the same time. So we can see what's significant, what isn't significant, what effects are stronger, and we can also control for things that are likely to affect the outcome, the attainment, like the gender of the child, ethnicity, household income, father's educational level, etc. All listed on the slide there. So let's look at the results. So this, I'm just going to explain what this model is showing here. So it's suggesting that both fathers and mothers' involvement is important. So they're both part of this complex system that affects child's educational development, but they do this in different ways. So the model shows that the father's childcare involvement has a positive and direct effect on the children's attainment at age 5, which is shown by this top arrow here, but it doesn't appear to significantly affect any of the domains of the child's behaviour, apart from a very small positive association with improving the child's conduct. On the other hand, the mother's childcare involvement has a stronger positive effect, on all the domains of the child's behaviour, but interestingly, a negative effect on the child's attainment, which suggests there might be something else going on here that we haven't accounted for. For example, maybe this is interacting with the child's, whether the child enjoys the school, maybe it's interacting with the mother's educational level. It's something we need to look into a bit more. But when you put everything together, when you add the total, you get the total effects, which are shown at the very bottom here. And this is when you add the total, the indirect and direct effects up. And our main headline from this is that of the parents, the one that is the most important for the child's educational achievement is the father. And that is shown by the significance of the total effects there. So the total effects from the father's involvement on children's attainment is positive and significant, but the total effects of the mother's involvement is not significant and actually close to 0, because the positive indirect and direct effects cancel each other out. So that's quite complicated. So I've done a nice summary slide here. This is what the model's showing. Both fathers and mothers' involvement is important, but they affect the child's development in different ways. So whilst the father's child involvement has a positive direct effect on the children's attainment at age 5, the mother's child involvement does not, but it does have a positive effect on all the domains of the child's behaviour. So the headline is, of the parents, the one that's the most important for supporting the children's educational achievement is the father. But that is not to say that the mother's involvement isn't important, because she is part of that system that supports this relationship. So if we look at the model, if we were to take the mother out of that system, the effect from the father's involvement might disappear, because everything is linked together. So in other words, it could be that the mother is the enabler of the father's involvement. So without the mother framing, let's say, the child's pro-social behaviour, the father might not have his chance to foster the child's educational achievement. Now that we don't know yet, it's speculation. We need to do some further testing around that. But I think it's clear here that from the data, for this, the father seems to be the most important for the actual educational achievement. What does this mean? Well, it suggests that the fathers and mothers have quite a unique contribution to the child's development. And I think it provides further evidence for why supporting fathers' childcare involvement is critical, because of the positive effect this has on children's outcomes, which in this case is educational development. So why we need things like good parental leave, flexible working, things like that. So I'm going to stop there, but yeah, very happy to answer any questions. Thank you.
To leave it at that, thank you so much everyone for attending. Thank you so much to our speakers, of course, and if you have any follow-up questions, please do get in touch with us or with the speakers directly, and another round of applause to our speakers.
Thanks to all the presenters this morning for a series of absolutely wonderful presentations, really, really interesting and insightful, lots that we have learned, I think. This is the final series of presentations as such, and the focus is going to be on reducing disadvantage, and I'm going to hand over to Gail Monroe from NatCen, who's going to chair this session. Thanks, Gail.
Welcome back, everyone. So my name is Gail Monroe. I'm Deputy Director in the Centre for Children and Families. As Sue was saying, we've got a really interesting set of papers for this session after lunch. We're going to start with Claudia Sumner from the Child Poverty Action Group, who's going to be speaking about reducing poverty-related disadvantage by exploring the cost of the school day. Claudia has extensive experience across the education sector in policy, research and practitioner roles. She's held posts at the UK Parliament's Education Select Committee, at UCL, at the Institute of Education and the NFER. She's a qualified primary school teacher, and her PhD thesis explored issues of equity and social justice in relation to school admissions. And Claudia, obviously really busy, and obviously sits on and also sits on the Brent Poverty Commission. So thanks, Claudia.
Right. Thank you very much. Hello, my name is Claudia. As Gail said, I work at the Child Poverty Action Group. I'm a practitioner on a project called the Cost of the School Day, which looks at cost barriers that children face in school. So our project is aimed at reducing the barriers that children face in their day-to-day school life. It's been going for about 10 years, and it's a collaboration between CPAG and an organisation called Children Northeast. And about 10 years ago, Children Northeast asked children living in poverty what single thing would make a big difference to their life. And what they identified was the cost of school. So CNE developed a program called poverty proofing, whereby we go into schools and we speak to children about how they experience various aspects of school. Since 2014, CPAG in Scotland has been running the program, and I work on the program in London. It's been running in England, funded by the National Lottery for the last 2.5 years. So what is poverty proofing? Well, it is trying to identify, it is helping schools and any organisation that really wants to be involved in making everything as accessible as possible to families on low incomes. The heart of our project is pupil voice. We have spoken to, in small groups, over 4,500 children. In schools, so our reach is more than 10,000 children. We've interviewed more than 800 parents and carers, 400 members of school staff. We also speak to governors and trustees. So in terms of the methodology, it's a very immediate project. We gather school level data, we survey families and parents. The heart of it is going into schools and we speak to children in small groups of 4 to 6. We work in primary and secondary. We speak to children from year 1 up to 6th form. We speak to at least 50% of the kids in the school. So we don't ask for a kind of sample. We speak to as many children as we can. We usually speak to about 80% of the children in the school. We ask them about their experience of the school day in a whole range of ways. We then write a report for the SLT. We have meetings with the SLT, and we try and encourage them to change their practice based on what we found, what we've been told. So it's an kind of immediate impact program, and we're all ex-teachers, the people who do gather the data. So in terms of the context, I'm sure this will be familiar to lots of people here. Almost a third of the children living in this country are growing up in poverty. In Islington, where we are today, it's about 40%. Down the road in Tower Hamlets, it's more than half. So it's a very large scale problem. When we go into schools, we start off with an assembly where we discuss the project, we introduce the project, and we show them these kind of slides. We tell them what the scale of the problem is, how many children in the ward that they go to school in are living in poverty in their local area in London. We tell them that we are there to get their views because their teachers want to know what they think about school. We also tell them this to let children know that although there is a stigma associated with living in poverty, it is a very widespread experience. Now, obviously, poverty interacts with other characteristics. Anyone can fall into living in poverty, but some groups are more at risk than others. So the majority of children growing up in families experiencing poverty are in working households. There is someone working in the household. So this isn't a problem that's just associated with unemployment. And also it's very difficult to work your way out of poverty since most people living in poverty are working. Children from ethnic minority backgrounds are almost twice as likely as white British families to be living in poverty. And if you have other characteristics in your household, such as someone with a disability, or if there's a caring element, or you're from a lone parent family, you're much more likely to be growing up in poverty. As we know, there is a link between poverty and attainment. So we help schools to try and take practical steps to try and help break that link. So, barriers faced by low-income families in schools. We help schools identify some of the areas that they can explore within their own school community, so families, children, staff, to help them understand the experiences that children growing up in poverty have at school. And our project is intended to help them identify those barriers and support them to reduce, or in some cases, remove those barriers. We also want to look at why it matters. Why does it matter that children growing up in poverty? And we want to place children at the heart of that, because we want, through our efforts, to ensure that pupils have a positive and fulfilling educational experience, regardless of their income, regardless of which school they go to. So what kind of things are we talking about? Well, these are the kind of more obvious things. Everyone with children or who has been to school will know that things like uniform cost money, food, residential trips, day trips, after school club, football club, revision guides, calculators, all these things have a cost associated with them, a direct cost. We also ask children about stigmatizing practices at school. So things like, I've taught for years in primary schools, in London primary school, and ordinarily after the holidays, I would say, what did you do in your holidays? I wouldn't do that now, because obviously that shows up the children who have spent 2 weeks in the Seychelles and the children whose highlight of their holiday was going to Tesco's with their cousin. So there are lots of things I think teachers do in no way maliciously. I think all schools really set out to do the best for their children. But there are stigmatizing practices that we all as practitioners do without seeing it from the child's perspective. So we try and help schools to see it from the child's perspective. So curriculum and learning are one of the areas that we ask about. The digital divide has had a lot of attention during the pandemic, but we do speak to children who still are expected to have internet access to do their homework. So lots of children we speak to don't have reliable Wi-Fi access, for example. They have to work on their parents' phone, they share a laptop, they don't have anywhere quiet to work, and that shows no attendance record, they're immediately disadvantaged. Children aren't allowed to do PE if they haven't got their PE kit. If there's a formal PE kit and you can't afford every element of the PE kit, you're immediately disadvantaged. Children tell us that if they haven't washed their PE kit, they don't want to bring it in. Their parents haven't done a wash that day, so they don't bring their PE kit in. This is about, we speak to children at secondary school about their GCSE choices. And a lot of children tell us that they don't choose things like food tech because you have to end up spending about 10 quid a fortnight on ingredients that you need to bring in. So they choose to actively avoid that subject. Same for things like photography and art. There are subjects that they know will have a cost implication, so they avoid those subjects. Some of the schools have addressed that by supplying ingredients. We worked with one school where the children told us that the teacher would supply ingredients if they told them in advance, but if you didn't supply your own ingredients, you couldn't take your food home with you. So an immediate kind of stigma that the school, I think, created absolutely unwittingly. Children who want to carry on doing music and can't because they can't afford the lessons. So a myriad of ways that the school experiences is curtailed for children on low incomes. Food is one of the biggest things raised by the children and families that we work with. The cost of food, the variety of food, the quality of food, the amount of food, but also the way lunch is organised. So, for example, this is from a year one pupil, so a 6-year-old, there's a milk list you get if you pay for it. So already, even in year one, a very clear experience of disadvantage. And children absolutely notice what everyone else does in their class. If someone else gets milk and you want milk and you can't afford it, you're immediately disadvantaged. Free school meal money is something that comes up a lot. Very few children, very few schools allow children to roll over their free school meal money. So if you don't use your whole allocation on one day, you lose it, it vanishes. It's a mystery to most schools where it goes. But we try and help support schools to see this, to say, why not roll it over? One of the, we hear from children as well about things like they can use their free school meal allowance at lunchtime, but they can't use it at break time. It doesn't kick in till noon on their account. But the nice food is at break time at the tuck shop. So again, the children feel this really acutely, that the people who've paid for their lunches can go and get cookies and a croissant, but they can't because they have to wait for lunch. The way school meals are organised, we worked with the school actually just last week. Great school, fantastic practice in London. The meal deal where you buy your kind of panini or your hot food was £2, a bottle of water was 65p, free school meal allowance was £2.60. So you're 5p short every day of being able to get a drink with your lunch. The school just hadn't seen it from the child's perspective. This is one of the children that told us that they couldn't get stuff at break time. And it's a real perceived unfairness and disadvantage. School fun, some of the things that people remember about school trips, Christmas fairs, Christmas shows, cake sales, all these kinds of things are much more difficult to access if you're on a low income. We heard a lot from children that they wouldn't talk about school trips at home because they didn't want to put their parents under pressure. So the stress that adults living in poverty feel is absolutely felt by the children as well, and they will try and protect their parents from any kind of uncomfortable situation or stress that they could inadvertently be causing by asking to go on a school trip. When children go in primary schools on school trips or in secondary schools, if they're allowed to take spending money, it's very obvious who can afford to bring spending money, who can't. Everyone goes on the trip. It could be a free trip. There are a lot of free trips in London. We're very lucky. There are lots of places to go that are free. Transport is free for children. But if you're going to the park, if you say you can bring £3 for an ice cream, some people will, some people won't afford to. And that's very noticeable when you're there. The trips, teacher puts on the board to show who's paid and who hasn't, or everyone stand up. If you paid for the trip, sit down. I remember that from school. I remember doing that as a teacher at school. Very stigmatizing practice. So we work with schools to help them see what school's like from the perspective of the student. We do talk to children about the stigma that they feel. And a lot of the stories we hear are frankly really heartbreaking. I spoke to a boy, lower sixth, doing maths, had fantastic GCSE results, was really enjoying his maths A-level, really excited about doing maths A-level. He got there in the first week and was told by his teacher that he needed to get a scientific calculator to use for maths A-level. He couldn't afford a scientific calculator, to save up 4 weeks, 40 quid. By then, he'd fallen behind because he was still using his GCSE calculator. So that's the kind of thing that we feed back to the teachers and ask them to look at. So a myriad of things. We then meet with the school, we give this feedback, we write a report with recommendations, very concrete recommendations. We then support the school to implement those recommendations. I'm told I've got 1 minute. I'll do it very quickly. So it's a very immediate impact research project. We gather all the data. We've got quotes from thousands of children. We try and feed into policy. There's been the Mike Amesbury bill recently to limit the cost of school uniform. So we're hoping that's a step in the right direction. But we don't think that experience should be based on your parents' income. These are some of the brilliant practice we've seen. Thank you very much.
Thank you so much, Claudia. Hopefully there will be some time for questions at the end, so do make a note of your questions. So our next speaker is Jude Hillary from the National Foundation for Educational Research. Jude's going to be talking about investigating the changing landscape of pupil disadvantage. Jude is co-head of the UK Policy and Practice team, leading 2 of NFER's strategic portfolio areas, systems and structures, which incorporates school funding and accountability, and optimal pathways, which incorporates education to employment and social mobility. Jude is also the PI of a large Nuffield-funded research programme entitled The Skills Imperative 2035, Essential Skills for Tomorrow's Workforce.
Thank you very much, Gail. Can you hear me? Yes. I've come here today from another presentation where I was talking about that project on skills. So I'm all over the place. I'm not talking about skills now, but if I break into speaking about skills, you know why. Today, in fact, I'm talking about some research that we've done recently at NFER, a bit of investigative research actually, looking at the impact of changes to the transitional arrangements to universal credit and what impact it had on the disadvantage gap measure and what that means. So I'm here today to share that with you. So sorry, do I just click on this? I should have checked this. There, okay. Right. So, by way of background, you may have noticed there's been a significant increase in free school meal eligibility in recent years. This is not only of interest in its own right, but obviously it has wider consequences for school funding and also for the measurement of the attainment gap, which is a key accountability measure for judging how well the government's doing with measuring, tackling the gap between disadvantaged pupils and their peers. It's also worth noting that any pupil who is in receipt of free school meals at any point in the last 6 years is counted as being disadvantaged when interpreting pupil attainment outcomes, and it attracts additional funding to the school. So, transitional arrangements introduced to smooth out the rollout of universal credit have had a significant impact on free school meal eligibility. I should perhaps start by saying what universal credit is, because some people might not know. So it's financial support available to UK residents aged 18 to state pension age on low incomes less than £16,000. And since April 2018, all families who all pupils in families who are in receipt of universal credit and have annual net earnings of less than 7,400 or less are eligible to claim free school meals. So it's not a very high threshold at all, and that you're eligible for it. So basically, anyone who's ordinarily eligible for free school meals would not remain so if their household income went above 7,400. However, when the universal credit was introduced, they introduced some transitional arrangements to smooth it in, as I sort of say. So effectively, if your household income did go above 7,400 in the transitional phase, then you basically retained your eligibility to free school meals. And you did so until the end of your phase of education. Just in terms of looking at what that might look like, this is a quick illustration, quite busy table. So before, if you're in reception, if you're a child who's in reception and you're eligible for free school meals before the transitional arrangements, you'll obviously be so in the after transitional arrangements. If in year one you no longer met the criteria for eligibility before the transitional arrangements, your FSM entitlement would end, but due to the transitional arrangements, you continue to receive it until the end of your phase of education, i.e. year 6, primary. But in terms of when you counted the disadvantage, it's even more than that, because actually it's based on an FSM 6 measure, which means that if you've been FSM, you'll be counted as disadvantaged for 6 years. So before the transitional arrangements, you're entitled in the first year, you'd be counted as disadvantaged for the next 6 years. After transitional arrangements, okay, so you lose your entitlement there. You end up getting it until the end of you get it while transitional arrangements are in place, which is expected to be 23 at the minimum, which kind of takes you somewhere to here. And then you get it for 6 years afterwards, which effectively takes you right through to the end of school. So okay, so what are the consequences of that? So this is quite a busy chart. I'll sort of just highlight it quickly, but it's worth sort of saying, first of all, because the transitional arrangements will run through to at least 2023 or potentially 2024. The problem with the impact that it has on the disadvantage gap measure, sorry, this is quite a technical presentation, won't actually kick in until 2020, until after the transitional arrangements. But after that point, effectively, the definition of disadvantage is changing every year. So you're going from an FSM 6 measure, FSM 7 measure, FSM 8, 9, etc., etc. So the universal credit transitional arrangements will continue to impact on FSM eligibility and disadvantage for many years. Indeed, we think this will go right into the impact of this will go right into the sort of 30s. Now, so what's the consequences of that? Well, first of all, let's let's look at what's been happening to percentage of FSM eligible pupils in secondary. So when the transitional arrangements started in 2018, 12.4% of pupils were eligible. 2022, that's jumped up 20%. And all other things being equal, assuming no policy changes, we're expecting these to keep on heading north. It's worth sort of saying as well, though, despite the headlines of FSM rates increasing, you may have seen them in the newspaper, almost all of the increase between 2021 and 2022 appears to be due to the universal credit transitional arrangements, not to the cost of living. Okay. Now, so the pupils who are now being protected by the transitional arrangements are largely pupils who might have already been considered to be in need of additional support. We say that basically because they're more likely to be from more disadvantaged areas and from disadvantaged schools. And they also have significantly lower attainment than non-FSM pupils, although slightly higher attainment than pupils who are already FSM. So they're closer to the FSM group than they are to the non-FSM group. And it's worth bearing in mind that part of the reason for this is because the threshold, the 7,400 threshold that I mentioned, has been frozen by the government for since 2018. So that means that basically, if your household income has increased by prices or earnings, if you're lucky, then you would have been phased off of free school meals. But because of the transitional arrangements, you're actually being retained. Well, I mean, if you're one of those families, it's great news. There's nothing wrong. But the problem we wanted this highlights is actually that so there's huge implications for the attainment gap. So there's a large and long-standing gap between educational outcomes between pupils who are economically disadvantaged and their peers. Claudia said as much just a while ago. There's some evidence that since 2011 this gap has been narrowing, although during the pandemic it started to widen again. So and several governments have kind of sort of said it's their priority to improve outcomes for disadvantaged pupils. And the disadvantaged gap is a key metric for actually holding the government to account as to whether their policies are actually helping to improve outcomes for disadvantaged pupils relative to their peers and help them to achieve their full potential. However, due to the changing definition, which is basically going to be changing every year, the measure is going to largely become meaningless due to these definitional changes, because effectively we're not going to be able to sort of say whether the change is due to observed characteristics, the composition, changing composition, whether it's due to economic conditions or indeed actually down to relative improvement in attainment. You know, I used to work in DFE. Anytime we saw an improvement or a narrowing of the gap, we put that down to our policies working. But what this sort of shows is actually because of the changing definition and the fact that the pupils who were in the non-disadvantaged group, who are now joining the disadvantaged group, actually have slightly higher attainment than the disadvantaged group. They're naturally going to pull the disadvantaged group average up, and that will have an impact on the measure. So we can't tell. We simply can't tell whether things are getting better or worse. So our recommendation is quite simple: that we need to do some work before 2023 or 2024, when this starts to affect, to look at the measure of disadvantage, so we can actually tell what's going on. And we need to start that now. So I've got a couple of years. And we also have a secondary recommendation here, which is about actually the government using their data better, the data that they have within the government estate, to identify the length of time that people have been disadvantaged. Because one of the other effects of the transitional arrangements is that we can't tell anymore how long somebody's been disadvantaged for. And we know that the persistently disadvantaged tend to have the worst outcomes of all. So by using their data more imaginatively and making use of things like the Digital Economy Act, they should be able to put in place a much more cost-effective way of and low burdensome way of collecting this data. We also had some recommendations, which I'm not going to spend a lot of time talking about, implications for school funding. All I would say is that pupil premium grant, okay, the amount of money that you receive if you're a pupil premium case, and if you're FSM6, sorry, hasn't been increased by prices since 2014-15, apart from this year actually, and it's made quite a big difference in terms of the value of the pupil premium. I think the figure is about 150. It's effectively £150 less than it was in value compared to when it was last at rate in 2014. So we recommended the government should consider increasing the pupil premium in line with prices over the next 5 years. And then the final one is really about providing some visibility about how much money is being given to schools for funding disadvantaged pupils, so we can know that it's reaching the right place. And that's me.
Thanks very much, Jude. So our third speaker is Kitty Stewart from the LSE. Title of her presentation is Levelling Down, Understanding the Decline in School-Based Early Childhood Education and Care in England. Kitty is Associate Professor in Social Policy and Associate Director of the Centre for Analysis of Social Exclusion at the LSE. She has a PhD in Economics from EUI in Florence, and her research focuses on child poverty and disadvantage, social security and early years policy.
Thank you very much. So this is joint work with my colleagues Ludovica Gambaro and Mary Reader, and it's work that's a little bit still in progress, maybe a bit more in progress than I thought it would be when I put my application in, but I think I've got some interesting findings and we're still kind of working through why we're seeing them. So just a bit of background so that you can follow along with the rest. Key points here, some of them already covered by Ivana this morning if you're in her talk. So we're talking about early education and care, particularly for 3-year-olds, 3 turning 4-year-olds in this paper. All children in England have the right to a free part-time early education place, 15 hours a week, from the term after they turn 3. Nowadays, since 2017, if your parents are working, essentially, you have the right to 30 hours a week. So there's a kind of new inequality built into the system now that if your parents are working, you get more time, more funded time. But that's not our interest in this paper. Our interest is in the diversity of experience that 15 hours actually means for children, because you can take up your 15 hours in a whole variety of different settings, maintained or state nursery classes and nursery schools, private and voluntary day nurseries, voluntary and private sector playgroups, independent schools, childminders, a whole host of different options. And these things that are useful to know is firstly part of this, and we talked about this a bit this morning, is part of this comes down to what's available in your area. So for sort of historical reasons, some areas, some local authorities are much more likely to have high levels of school-based provision available because lots of inner cities developed that provision back in the 60s and 70s, and we still have that kind of inheritance today. Whereas when this was rolled out as a national policy in the late 90s, early 2000s under Labour, Labour made an explicit decision to go with a sort of mixed market approach and not to develop the school-based provision. So what's happened to kind of fill in the gap since then has all taken place in private and voluntary sector settings. And there's big variety differences between these. Part of that's about opening hours. whether it's school hours only or wraparound care that's better for kind of childcare provision. And crucially, there's real differences in terms of quality criteria. So if you are in a school-based nursery, you will have your class will be led by a qualified teacher who has qualified teacher status and all of the pay and conditions that come with that. You'll have a bigger group size, but you'll have a qualified staff leader. Whereas in the private and voluntary sector, the requirements are much, much lower. You'll have a smaller group size, but much less good qualifications. And we saw from Eliza's presentation in one of the sessions this morning, really interesting stuff, which really shows that it's not just the higher qualifications mean that you're going to have higher retention rates of staff. And she talked about the fact that because of the low qualifications and low pay and so on, it can be hard to retain staff, and it can be really hard to attract high quality staff into the private and voluntary sector settings. So it matters really where you go. And so in this paper, we're focusing on the year before reception, children are rising 4, and we're using data from the National Pupil Database, which takes a snapshot of the whole population who are enrolled in January of each year. And we're looking at a decade, pre-COVID decade, January 2009 to January 2019. And we're using free school meal status in reception year as a mark of disadvantage, very blunt, but that's all we have really in the National Pupil Database. And of course, it also has, not just blunt, has maybe some problems as Jude has been talking about in terms of the consistency of that over time. We don't have that when children are in their nursery year, so we have to track the children forward into reception to find out if they're going to be a free school meal child in reception. That's why we're not going all the way to 2020, which we do have data for, because we need that 2020 year to capture their free school meal status. Okay, so our starting points are that we are seeing a decline in the total number of attendees in the maintained and voluntary settings, first of all. So here we have the number of children going to different types of place. And you can see the blue line there is the maintained nursery classes in schools. You can see that particularly from 2012, we're seeing a slow but steady and increasing in recent years decline in the number of children going to those settings. We're also seeing that in the voluntary sector, the yellow line at the bottom, whereas the private sector is growing. So if back in 2009, the norm for the most common thing that children were doing was going to a school-based nursery. Now that's not true. The most common thing is going to a private sector setting. And you may think, well, part of this, I've told you there's kind of the hours issue. So part of this is likely to reflect more and more parents wanting childcare so that they can work and wanting the longer hours. But we know that it's not just that, because we're also seeing, and this is the bit that we're really worried about, a decline in the relative advantage that free school meal children enjoy in accessing the maintained sector. So this shows us the share of children who access a funded place, who are in the maintained sector. And we've got in blue children who will go on to be free school meal children. So back at the beginning of the decade, 72% of children who would go on to be free school meals in reception were taking up their place in a school-based setting. So 72% of those children were getting at least a year in a classroom headed by a qualified teacher. And they were getting a much better deal than other children on average. So this was something that we noticed and wrote about years ago. And we argued that this was an exceedingly rare, we think unique example where social policy is doing the right thing in terms of trying to tackle inequalities, because it's managing to get the best provision to the disadvantaged children, the children who need that most. I can't think of a single other example in social policy where the disadvantaged get the best deal. So we celebrated that and we're really pleased with it. Then we went back and looked at the data and we looked and we thought, uh-oh, what's going on? They still have this advantage, but we're seeing it being eroded over time. And no one's really noticing this or remarking on it, but this is making a difference. We now only have 56% of children who are getting that, and more of them. The most common, again, is the thing that's rising is they're in private sector settings. So if we think this is better quality, we're worried about what this means. So our research questions are to try to understand why we're seeing this. And I won't say, first of all, why we're seeing the overall decline. We think that must be something to do with funding. We've just done a freedom of information request and got information on all the funding formulas. So we're going to be looking into that to see whether that helps to explain what's happening here. But I'm going to focus on the second part here, which is particularly this issue about what's happening to free school meal children. And we have 4 potential hypotheses of what's happening. The first, why we're seeing that decline hitting them harder than the average child. The first is this could be about what's happening to the geography of the maintained sector. So I've told you that they're historically located in the inner city areas. Perhaps it's those areas have been maintained places are falling more in those areas or in the areas where the disadvantaged children are more likely to be. Perhaps it's about the geography of poverty itself. Perhaps there have been falls in the concentration of free school meal children in the areas, like in London, where those maintained nurseries are. Thirdly, it could be about what's happening within a local authority. So perhaps within a local authority, whatever's happening to the number of places, the free school meal children are less likely than they were before to be getting access to the maintained nurseries. Or it could be an artifact of the changes in FSM, the composition of the children, and Jude's already talked about how this is not the most stable necessarily measure. Luckily, we're not affected by these particular issues in recent years, but there was the introduction of universal free school meals in the middle of this decade. We know at least for a year, work that Angus has done with colleagues has shown that did change things, at least temporarily. Okay, so let me show you a few graphs quickly. I've got 5 minutes now. Changing geography of the maintained sector, first of all. What this shows you is on the x-axis, we've got the share of children who are free school meal in reception in 2009 by local authorities. And then this shows us the percentage change. So anyone on this side has seen a drop in their maintained, and here we're seeing an increase in the maintained sector over the decades. So you can see it's not very strong, but there does seem to be a correlation here. So if you're in that top quadrant, if you're in that top half, you're above the red line, that means you've got more than the average level of free school meal children in your area. Almost all of those areas have seen a decline in the maintained sector. Whereas among the less deprived local authorities, the picture is more mixed. Some have seen a decline, but some areas have actually managed to expand their maintained sector. So there does seem to be something going on here about where, where the places are. And that is what we're looking at. That's what the funding formula is going to help us understand more about what's happening there. But this seems to me more convincing, actually, as a potential explanation, which is the changing geography of poverty. So what we're seeing here, we've got the share of children up here, the share of children who go to the maintained sector, share of all children in the local authority who go to the maintained sector in 2009. So you can see huge variation across the country from, someone almost this local authority in the southwest has no maintained sector provision. At the top, there are areas in inner London that have almost all their provision is maintained in 2009. And then this shows us the percentage change in the share of children who claim free school meals, who are eligible for it, over the decade. What are we seeing? Areas that have lots of maintained provision have seen drops in their free school meal share in that top quadrant, whereas areas that have less maintained have seen increases in their free school meal share. So, and if you look at who they are, you can see that what seems to be happening is children are moving out of inner London and outer London into the southeast and the east of England. And similarly, they seem to be moving out of parts of the northwest that have high maintained into parts of the northwest that have less maintained. So this is consistent with what we know about what's happening with gentrification more generally, but also what we know about what's happening to benefits and the difficulty with caps on housing support of children of lower income families being able to live in high, more expensive areas. So the worry here, and we're going to do more work on it, but this seems to suggest that, the geography of poverty is changing in a way that means children have less access to high quality provision. I'm sure I'm going to be shut up at any second, but very quickly, this is what's going on within the areas now. So that's all about the geography of who's where. Now think about a child within a particular local authority, and given the provision that's available, is the free school meal child more or less likely than the non-free school meal child to be accessing the school place? Well, if you're above the 1, let's look at the x-axis first. If you're above 1, that means as a free school meal child, you're more likely to be accessing a maintained place than another child who's not a free school meal child. And you can see that everybody's above 1. So within any given local authority across the country, you're more likely to go to maintained sector if you are low income. But we are seeing that eroding as we move across the decade. So all of those local authorities that are above that line, that is being eroded within the local authority. So they're all still above 1 pretty much here. Most of them are, these ones aren't above 1 anymore, but less so. So that says that this isn't just about geography, it's also about what's happening within the local authority. And because of shortage of time, there are kind of 3 policy changes that we think might have had an impact, and I'll focus on this top one because I think this is the one that's most likely. We have this policy, we have a policy that rolled out places for 2-year-olds, for disadvantaged 2-year-olds, which seemed like a brilliant idea, but it may have had a negative knock-on consequence. Because what we think may have happened is that if initially, certainly, schools weren't really taking 2-year-olds. So when you had your 2-year-olds and you wanted them to have a place, you would need to take them to a private or voluntary sector setting. And then, of course, if your 2-year-old is in the private sector setting, you're more likely when they turn 3 to leave them there. So we think that this could have been why we see this, this changing pattern even within local authorities. That we looked at, we think the 30 hours policy, I can talk about that in questions if we want to, but we don't think that's part of the story. And we don't think that this is a big part of the story. And I won't kind of talk you through all of the regressions, except to say that these are the raw coefficients at the top that show you the big picture. And then what we've done is control for the individual child's characteristics, to take out any sort of compositional effects, and we see a bit of a flattening of the decline over the time, and then we control for the geography. And you can see a lot of flattening between model 2 and model 3 that controls for the geography, which suggests that the geography story is a big part of it, but it doesn't get rid of things entirely. And it looks like it's when the 2-year-old places come in that you see a bit more of a hit. It's not a big thing, but we're going to try and look into that a bit more. Okay, so in sum, we've seen this decline in the total share going to the maintained sector and also the voluntary sector. And this is affecting the free school meal children more than others. And we are really worried about this because we think it really says something about the erosion of this sort of advantage that they were enjoying. And we think that there's a whole lot of reason for this, not just one. There's a whole lot. We think there's kind of each of these has there's a constellation of factors which is contributing to this. So we're doing a bit more work to try and pin down more precisely which of these explanations are larger than others. Thank you.
Thank you very much, Kitty. So our final speaker for this session is my colleague Yona Berry from NatCen. Yona is going to be talking about some evaluation work of the Opportunity Areas programme. Yona has led on a range of qualitative and mixed methods evaluations, overseeing data collection, data analysis and reporting. Recent projects include the online tuition pilot for the EEF, stability of the early years workforce for the Social Mobility Commission, and this Opportunity Areas evaluation for the DfE. Yona has a particular interest in the early years workforce. He's currently leading a randomised control trial for the EF involving 165 settings participating in the Hannon programme, which is a professional development programme, a professional development course for early years practitioners.
Thanks a lot, Gail, for the introduction and welcome everyone. Yeah, I'm really pleased to have the chance to present the findings of the opportunity areas evaluation to everyone in the room as well as online. You'll see that I included the name of my colleague on the slide. It's also worth highlighting that we were quite a big team of researchers, and they should get credit for this as well. It was quite a large scale evaluation. I want to focus on three things today. I want to say a few words about the Opportunity Areas program. Then I'm very briefly going to discuss, say a bit about the evaluation aims and methods. I won't be able to go into too much detail, but I do think it's important for the audience to get a sense of what the evaluation was about and how we went about collecting the data. And then, if you will, the main part of the evaluation, I will share with you some of our findings on place-based working, namely what participants saw as the benefits, as well as the shortcomings of a place-based approach, as well as what they thought characterized a place-based approach and place-based working. So what is the Opportunity Areas program? The overarching aim of the Opportunity Areas program, which sits with the Department for Education, is to improve social mobility through education, mainly through a range of projects, interventions aimed at the early years all the way to post-16. So there's inbuilt in that program, there's, if you will, a recognition that social mobility challenges in the UK differ by place. The program is targeted at 12 areas or local authority districts in coastal, urban, and rural parts of England, all of which face entrenched social and economic challenges. I'm not going to list all of the OA areas, but examples include Hastings, Bradford, as well as West Somerset, so very varied. The program itself started in 2016, in late 2016, and initially it was envisaged that it would last for 3 years, but it was then extended twice, and it's actually coming to an end this summer. Now, I've already mentioned this, the OA program adopts a place-based approach, and it's just worth spelling out some of the key features or key components of that approach. So that program. So the main feature is that a defined local area, so I mentioned there are 12, is given funding to deliver projects that meet local need. And over the course of the program, a total of 108 million, yeah, that's correct, pounds was spent across all 12 areas. The second point worth highlighting is that DFE staff work locally, but then there's also a so-called head of delivery that leads the delivery team in one or more OAs, and they provide a link between the central DFE team and local stakeholders. Each OA has what's called a partnership board, which has strategic direction and an oversight of the OA alongside the OA delivery team. And that partnership board is comprised of local systems leaders, so individuals from across a number of sectors, health, education, business. Each area has or is tasked with publishing was tasked with publishing a delivery plan, which spelled out local priorities. And a key part of designing that local delivery plan was actually engaging with stakeholders locally to get a sense of what the key local priorities are. And finally, each OA is also twinned with another area facing similar challenges to work in partnership and share best practice. So this was a short overview of the program. Now, the evaluation was a qualitative process evaluation, a formative evaluation that was focused on the first 4 years of delivery. So the final year of the program, I said it's coming to an end this summer, that did not feature, that was not part of our evaluation. Now I've listed on this slide 6 aims, if you will. I'm not gonna read all of those out, but it's what I want to focus on today really is the second one, the benefits and the challenges of the place-based approach, because that really is absolutely key to this program. Just a few words on the design. So the qualitative evaluation was divided into 3 fieldwork waves between November 2020 and September 2021. And in each wave, the data collection design was replicated across each of the 12 OAs. So in other words, we carried out the same approach to data collection in all 12 areas. And over the 3 waves, so between November 2020 and September 2021, we conducted 162 interviews and 27 focus groups. I did say we were quite a big team, and I think that really underlines that very fact. So you can see that this was very much a large-scale process evaluation. So here's just a very short overview of the different participant groups that we spoke to across the 3 waves. Although you can see a number of roles, it's basically we spoke to 3 different participant groups. So we spoke to individuals that had a strategic remit, such as heads of delivery and chairs. We spoke to stakeholders in more operational roles, such as delivery leads and project leads. And then we also spoke to those taking part and benefiting from the projects and interventions, so-called beneficiaries, so parents, young people, as well as teachers or early years practitioners. There are two aspects that are worth highlighting. Unfortunately, if you do read the report, it was published last month. We didn't get to speak to as many beneficiaries as envisaged, so that kind of voice, that young people's voice or parents' voice is not as pronounced as ideally it should have been. But there were a lot of challenges around recruitment, especially during COVID and the summer holiday. And the second point I think is also really important to mention is that we interviewed some stakeholders up to 4 times. And their commitment was really commendable. So there was real buy-in from a very senior level in the evaluation. Yeah, I think that's worth highlighting, because recruitment, as we all know, can sometimes be quite challenging. So the findings I'm about to present on place-based working, they're based on interviews we carried out in waves 2 and 3, primarily with strategic stakeholders as well as some local stakeholders. So one of the things we were interested in is what characterizes a place-based approach, and interviewees discussed this in relation to the OA, but also in a more generic way. And there were 2 themes that really came out. The first was around the unit of place. So the idea that a place-based approach required first and foremost some kind of decision on the area or unit that constitutes place. So in other words, does the place where the program is being implemented cover a ward, wards, local authority districts, regions, etc.? And speaking about the OA specifically, interviewees contrasted local authority districts with a clearly defined boundary with those consisting of, quote, a collection of places. So a number of small distinct places with several small towns that had different demographics and distinct identities. And the key point, and this is what they highlighted, and this is really a key point, is that it was easier for a place-based program like the OA to engage stakeholders in places with a coherent identity, and those places were more likely to carry meaning to individuals compared to OAs covering multiple small places and where residents were unlikely to identify with the place. And that kind of sentiment is really illustrated by this quote where an interviewee reflected on an OA that they suggested didn't really mean much to locals. I'll briefly revisit this point in a bit. The second characteristic of a place-based approach that participants highlighted was around engaging with and involving local stakeholders. So participants really agreed that a place-based approach needed to involve the local population, and that really meant three things. First, spending enough time diagnosing local challenges and strengths to come up with a strategy for place-based working. It meant co-designing a place-based program with credible local stakeholders that were known in the area, and therefore avoiding the perception that of place-based delivery somehow being controlled from central government. And finally, and importantly, using local delivery organizations to design and deliver bespoke programs. This now brings me to some of the perceived benefits of a place-based approach. So interviewees cited several kind of overlapping benefits of a place-based approach. So the first one was the ability to decide on local priorities. And they really considered that important, given that each place has unique challenges. And interviewees really thought that the involvement of local stakeholders to shape the program from the start was very much unique to the OA program. And that's captured by the sentiment at the bottom of the slide here. Relevant provision. So local choice meant that provision was likely to be relevant and respond to an existing need. So for instance, in a coastal OA, the delivery team, what they did is they commissioned projects that suited the needs of small schools that were not part of multi-academy trusts. And local delivery organizations were seen to know best and where and how to reach beneficiaries, especially those that tended to be underreached. And that's kind of illustrated by the quote at the top of the slide. Third, local buy-in. So interviewees reflected that partnership board members and local delivery organizations kind of were likely to be trusted by the local population, given the fact that they were locally embedded and had very good and extensive knowledge of the area. And finally, and this is an important point around sustainability and legacy, there was a view that local stakeholders, that projects were more likely to stay in the area if local stakeholders were involved. I'm very conscious of time, but I do want to turn to some of the challenges that were mentioned very briefly. So an important one was the lack of transport and distances between places. So that was a real challenge to beneficiary engagement and attendance. And that was especially the case in more rural areas or coastal areas. So for instance, in one OA, poor transport links meant that a literacy project that was supposed to take place in a museum had to take place in a supermarket. There was also a point made around fragmented education landscapes, which hindered collaboration between schools. The fragmented education landscape was one that was characterized by different multi-academy trusts, small academies, as well as maintained schools, whereas in sort of more homogeneous education landscapes, collaboration between schools tended to be smoother. I've mentioned a bit about identity of place, so the fact that an area that seemingly lacked a coherent identity made it more difficult to mobilize beneficiaries. Finally, one on size of place, so a focus on too big an area was seen to limit engagements because projects could not always account for differences between places and their needs. And one interesting suggestion that a participant made was that it might make more sensible, instead of having a whole town approach, to focus the program on specific wards. I know time's up, but I think it's worth just adding a final reflection and kind of briefly going back to the theme of the session, which is about reducing disadvantage. I mean, if there's one theme that really came out of all interviews, it's the idea that tackling disadvantage or wanting to improve social mobility requires local solutions. Why? Because social mobility challenges are not the same everywhere. In other words, the issues facing young children and families in Blackpool are not the same as those facing families in Ipswich. And that needs to be recognized. And I would argue that this program very much accounts for that kind of place-based, for those place-based differences. Thanks a lot.
Thanks very much, Yona, and thanks very much to all our speakers. We've got 4 minutes for questions. So if the panelists would like to come and take these seats, if that's okay. And whilst they're doing that, does anybody have a question? Otherwise, we'll go online. I think a few people online have got questions, but does anybody in the room have a question? Hi, yes.
When I saw Claudia about the impact of all the schools, do you find that those things, you know, to go back and see if things got better?
We do. We keep in contact with all the schools we work with, and we help them set up working groups. Sometimes it's just one member of staff, sometimes it's the kids and the parents. We try and encourage them to give someone or a small group an ownership of the report and the changes that they might like to make. Some of the schools we've worked in, before they get the report, we do a feedback session. Oh, thank you. We do a feedback session with the SRT. Some of them say there and then, oh my God, we just never thought of that. We'll change that today. So we see the impact instantly with some of them. Obviously, it depends on how the school set up, whether how much buy-in there is from the head teacher. But yes, one of the things that's been really great is we can gather best practice and we can then disseminate. So when we see a problem, say a uniform problem, if it's expensive uniform, or if it's hard to get, or if it's a supplier or something, that's a barrier, we can then go to the other schools we work with who've got kind of fantastic second-hand uniform provision, for example, and disseminate it. So yes, sometimes it's instant.
Thank you. Any other questions? Hi. Yes.
A question for Kitty on University of Essex. How much consistency or variation is there in how places that maintain providers get allocated if there's over demand?
How much consistency is there?
Yeah, do LAs have the power to decide we want to prioritise children from high deprivation areas for our places in maintained provision, for example?
I don't think so. But that's a good question. They definitely used to be able to prioritise in terms of longer hours in the day. So someone like let people stay for a whole day if they thought that they could gain from it. That's changed with the new 30 hours policy. They can't do that anymore. They have to prioritise families that are working. Whether they can prioritise, I don't know. I haven't thought about that, but I will find out and let them know.
I think we've got time for one more question. Great.
So this question is from Beatrice at Early Education. This question for Kitty. Have you looked at whether there is a sign that falling disadvantaged children in school nurseries reflects any change in the number of school nursery classes available? Also, would a governor-run PVI provision count as school or PVI in your data? As there have been some examples of schools converting their teacher-led nurseries into site PVA provisions at the same time. Very lengthy question.
No, those are both very good questions. So, yeah, I think that the latter one is about whether it's basically a school takes its nursery and turns it into a kind of PVI sort of provision in order to save money and therefore no longer have a qualified teacher. Yeah, I think we can't see that very easily. I mean, I think we could see it, but it would be very data intensive in terms of tracking. But it's something I will note down and have a think about. I mean, of course, if they're getting rid of the teacher, we see this pattern. I could have showed you the same in terms of what this is really about. Like, the important thing is not necessarily the maintaining that, and it's the state. It's the fact that it's who's in charge and what the qualifications of the teacher are. So this reflects very much what we're seeing in terms of qualifications. But yeah, that's a potential mechanism. So I have to think about that. The first question was.
Have you looked at whether there is any sign that the fall in disadvantaged children in school nursery classes reflects any change in the number of school nursery classes available?
Yeah, so the interesting, I mean, our starting assumption was that that's what it reflects. And we're going to be looking at the funding formula to try and see whether areas that that decline seems to reflect changes in the way that the places are being funded, which would suggest that it's to do with the supply. In fact, then I've had a couple of conversations with local authorities who have challenged that a little bit and said it's not about supply, it's about demand. And actually, all of our nurseries, Hackney told me all of our school nurseries are undersubscribed. So it's not that it's not there, it's that the children aren't coming in. So that, I mean, that's interesting in terms of the different explanations, because that would suggest it's more to do with where the low-income children are, so there's probably a poverty story. And it could be to do with the story about two-year-old faces and the fact that they're already settled somewhere else, so they're no longer, it's disruptive to move them at that stage. So it's, I mean, basically, the really good data is about where the children go. It's not about what the places are available for. I'm just going to interpret what that reflects.
Thank you very much. I think we're out of time now, but thanks so much for all 4 speakers. And I'm going to pass back to Sue now. She's going to tell us what's happening next.
Okay, thanks very much, Gail. Thanks again to our speakers. So we've got another 15-minute break, Katie? 10-minute break. So quickly grab yourselves a drink or a snack from downstairs. And then we're coming back for our final session, which is going to be a panel session led by Brandon and Jeffrey. So I'm really looking forward to that final slot. See you later. Okay, everyone. Well, thank you for coming back in a timely fashion. I'm really looking forward to this final session after a day of excellent presentations. And it's my great privilege to introduce Brandon Jeffries, who is a very familiar face, I think, to many of us. And Brandon is a journalist and broadcaster who's covered different areas of social policy over 3 decades. And as a specialist journalist, her interests are focused, as many of us will know, on education and how research and data relate to lived experience. And she's currently the education editor for BBC News. So I'm going to hand over to Bramwyn, who's going to chair this final panel session. So thank you very much.
Sue, thank you very, very much indeed. It's a very timely discussion. I'm delighted to be here. I'm sorry I couldn't be here for more of the very rich discussion that I've been seeing going on during the day on the social feeds. I'm going to start by introducing our panel. We've got a huge wealth and range of experience here. So starting with Tina Hauk, so many of you will know, is the director of the Centre for Children and Families at NatCen, with a huge range of experience in government and the third sector and in the research field. We also have with us John Watson, the Executive Principal of Canterbury Academy Trust, working in a very particular context in Kent. We've just been talking about it in a highly selective area, trying to provide a very wide range of opportunities and aspirations to the young people within the trust. He's got 20 years of leadership experience in education, but the ethos of the trust is very much schools for all the talents, trying to find what works for each child and to optimize their possibilities for each learner, whatever their talents, looking for the good in every child and taking with that the philosophy that all children walk with genius. Amy Mitchell, the Executive Director of Teach First, also has a vested interest as a mum of 2 young children, but trained with Teach First, first of all in East London. Of course, Teach First has been a very important part, actually, the regeneration of London schools and of the fantastic quality of teaching. And then after a master's at the Institute for Education, has gone on to support the development of teaching, training and teaching within the charity, leading on the digital learning before taking on her role as Executive Director. Chris Goulden is Director of Impact and Evidence at the Youth Futures Foundation, which is a What Works Centre on youth employment and skills. Skills, of course, being very much one of the policy priorities of the current government, looking for alternative routes and qualifications for young people coming out of education. Before that, he was at the Joseph Rowntree Foundation in a wide range of roles, Deputy Director of Policy, Head of Policy and Research, having joined the organisation as Poverty Programme Manager, but he also has experience in government, having previously been at the Prime Minister's Strategy Unit. So I'm going to start our discussions with this fantastically experienced and wide-ranging panel, just by sort of reflecting on what we know. As with many things, the pandemic drew our attention to the detail of inequality that exists across children's educational experience. The digital divide in particular comes to mind. So it's not that these inequalities didn't exist before, but that they were deepened by the absence of the shared school experience. And we know that coming out of the pandemic, some of the progress that have been made in narrowing those gaps in educational attainment is feared to have been lost. So I'm going to start by asking each of you, and probably makes sense given you sharing a microphone to go left to right, starting with you, Tina. What do we know about the current state of educational inequality, and what don't we know? What gaps are missing and have been highlighted by the experience of the pandemic?
Thank you, Brandon. Is that on? Yes, thank you, Brandon. Always good to go first. I think we heard a lot today about what we know. I think we heard a lot today from the early years about children not having attended nursery sufficiently, being behind in terms of their developmental and social skills. And we've learned actually that I think parents are thinking about early years education as something fundamental, something that they can't replace at home, which I think is an important shift. We heard about children being behind in schools, 1 or 2 months behind, and I think we also know about the different groups, the different characteristics, the different year groups, particularly disadvantages being exacerbated that existed before. So my sense, actually, I also think this is a very well-researched crisis. The ESRC has spent a lot of money, NAFUD have. I don't think we've ever known as much or collected as much data about a crisis that as we have this time. So I think we know. We have a very good sense of where we are in terms of educational disadvantage, and there's a lot of data collection going forward. What we don't know, what we should be doing differently, I think, is I don't think we hear enough from children. So I think it was really interesting to hear Julia from the Children's Commissioner's Office this morning, hearing from children. I think we need to be more inclusive in our research practice, and moving online, I think, has brought new challenges to that, different inclusivity. But I was also speaking to one of my colleagues earlier, and I think we started a pandemic thinking we're going to revolutionize. This is our chance to really think again and come up with radical solutions. And in the day-to-day managing of the pandemic, I think we've sort of lost sight of that. So my answer would be, I think we have a lot of data. We need slightly better data, more from children, but I think we need to also go back to ideas.
Okay, and just to follow up on that, in terms of regional disparities, something again that's always been there, is it your sense that the data that's come out, or the tracking that's been done during the pandemic, shows that those have entrenched or deepened in any way?
I think all existing inequalities have deepened. Regional in terms of children's characteristics, in terms of particular phases around transitions, SEN children, ethnicity, absolutely, yes.
Okay, so over to John. John, of course, you were, as a leader in education, living and breathing the constant change that you were having to deal with, adapting throughout the pandemic. How would you now assess the state of things? You know, people talk about catch up, but that's a phrase that many people don't like and are choosing not to use.
I think I'll try without the microphone. I hope everyone can
You'll need it for the online audience.
Oh, okay. Understood. What I would do, I think
I would go a bit further back on the research, and I'll just talk a little bit about some of the experience that we've had across our multi-academy trust and some of the things that families dealt with. So looking outside of the numbers, through the pandemic, we had significant numbers of families that were losing their jobs. We had numbers of families, particularly adults, who were not able to process the loss of the job. They weren't able to kind of go through the emotional resilience. They weren't able to articulate that. They didn't have the emotional literacy to be able to explain how they were feeling. That would sometimes manifest itself in increased levels of alcohol use. That would then contribute to high levels of DV, domestic violence. And so a cycle begun, which really sat very deeply beneath lots of those kind of data-driven issues. So we had families who couldn't provide a basic way of life through no fault of their own. So education for them at that point, being able to get near a device that might see them access some sort of Google Classroom or Zoom was, with the hugest of respect, somewhere near the bottom of their priority list. They weren't able to put food on the table for their family at that particular time. And that leaves alone families as well that were going through grievance, were suffering loss and death through COVID. And that pertains to our trust, not just with families that we work with in the community, but also staff members as well. You'll know we're a school in Kent. Kent, particularly in the second wave of COVID, was hit very strong with the now infamous Kent variant. And we had a significant number of staff who were really quite incredibly ill, to the point where I thought that actually over Christmas of 2020, we might lose a couple of staff. So that kind of penetrates really, really deeply, and how you begin to recover from that makes it really, really difficult. So we've actually prioritised above the educational existence. We've bought beds for young people. We've bought microwaves, we've bought fridges, we've bought ovens, we've given families the ability to cook for themselves, to be able to live. And then we've kind of tried to layer up that resilience and that confidence again to get back into education, because for them at that moment in time, it just wasn't on their radar ground at all, really.
What would you say to those who say this is extending far beyond the reach of what schools can or should be doing? I mean, that's been implied by the Chief Inspector of Ofsted, that schools should have focused more on education and a little less on food parcels, I think was her comment.
And look, I'm very conscious to be kind of balanced in the views politically. Look, you know, some of the things that the government did were very much welcomed. The laptop provision was very much welcomed. Actually, on the grass or on the ground, that didn't materialise quite as quickly as we would have liked it to have done. They started to put free school meal vouchers in place over a period of time as well, which again, that's being continued. It's certainly being continued through our local council at Kent. In terms of then getting students back engaged in education moving forward, the catch-up money again, in whichever guise that is coming, has been hugely welcomed. The tutoring has been a bit hit and miss. Initially, we were directed to use prescribed government catch-up tutors. There's been flexibility, and the government, to be fair, have listened to schools since then. There was some flexibility in that, so we can employ people directly ourselves, and that has worked much better. But even now, you know, particularly as we've gone into this summer exam season, there are still very, very high levels of anxiety amongst students. There are very, very high levels of anxiety amongst their families, and there are still high levels of anxieties amongst staff. Last week, there was a 75% increase in COVID cases. And at the moment, across our trust, we've got between 12 and 15 staff off with COVID, despite being vaccinated, and they are still suffering quite badly. Of course, there's still the ongoing impact to attendance for young people as well.
Brilliant. Amy, obviously this was probably the most challenging time that any teachers have ever experienced. You're not just training and supporting new teachers, but obviously there's a big alumni network as well from Teach First. What were you hearing from them, and where do you think things are at now?
Yeah, so I would absolutely agree with what colleagues have said. Teachers and leaders working in schools have had the most challenging time I think we could ever have. Well, we just didn't predict it, and particularly new teachers entering classrooms in September 2020, September 2021, their experience is unlike anyone else entering the profession in memory, and the leaders who are having to lead those schools through unprecedented times. We've just heard tales, just devastating stories coming out of those individual schools, because Teach First works specifically with schools serving low-income communities. In terms of the data, we've said here, we have a lot of data. There is a lot of information about what schools and children are going through and have been through as a result of the pandemic. What we do know is that pre-pandemic, kids from low-income communities were they were 18 months behind their more affluent peers. And it's since the pandemic, we have seen 10 years of progress wiped off through data coming out of the EEF. And that is at the heart of what Teach First are here for. And we've seen 10 years eroded, which is devastating in and of itself. In terms of where we think there are gaps in the data though, what we need, and we've seen this throughout the day with the papers that have been presented, is there is data in so many different institutions and suppliers across the sector, and it's really challenging to join those pieces of those data sets up. And we've heard, and forgive me, I won't remember the presenter's name, so apologies. We've heard the school as hub and how they need to be able to leverage the different suppliers and organizations across the sector. But that is very challenging to do if we can't have this like a coherent and pulled together data set. So that would be one thing we're really hearing from our teachers and leaders. And the other is tracking kids. So we focus a lot, we've heard a lot today about early years. My kids are in the early years, it's so important. And we need to understand, where are these kids going? Where we understand the GCSEs, we see where they're going in further education. We see where they're going into university or into apprenticeships, but where are they going beyond that? And how are we serving them to have, to enter the world of work? Because at the moment, unfortunately, we know that kids from low-income communities are twice as likely to end up NEET, not in education, employment or training. And so we need to be able to serve them through the data that sees them into their first and second jobs.
Is there a silver lining in this, in that there were transformational changes in the skills that teachers acquired? Who would have ever have thought that we would have put education entirely online? And so in terms of communication skills, engagement, use of technology, is there something good that we can take away?
I think yes, but I think we touched on it right at the beginning. I think there is something there, but I don't know that we've capitalized on it just yet for two reasons. One, the digital divide. We've spoken about that a lot today. There are kids from low-income families that are just less able to access that in the same way as their more affluent peers. But also the infrastructure in schools means that whilst the skills have definitely been there and teachers in schools did a phenomenal job, particularly as we went through the second and third lockdowns where the provision was so high quality in some areas. But just the infrastructure and the ability to leverage the software, I think, really well, akin to other organizations and businesses, is really challenging for schools to do, primarily budget driven, but capacity and just resource to be able to do that really well. I think Microsoft and Google have done a lot to implement that across the country, but procurement of technology, implementation of technology strategies, these sorts of things just aren't widely available in schools, which I think, and just inherent flexibility as well that other organizations are enjoying. I use that term loosely. I think schools are finding that more difficult to sort of ride that wave.
Thank you. Chris, Amy touched on NEETs, on school leavers and the opportunities. Of course, there were some who found themselves leaving school at a time when there was very little work or no work or very few other opportunities available to them. Many charities were struggling profoundly, particularly at the grassroots level where many of those working with NEETs operate. What did you see during that time, and where are we now?
Yeah, it was a very difficult time. So in many ways, the effect of the pandemic on employment and unemployment and education actually was unexpected in some ways, because I think when the pandemic hit and sectors were starting to get locked down, there was a big fear that this was going to be a massive recession, very high unemployment, particularly affecting young people because of the kinds of sectors they were more likely to work in. And those were the ones most affected by the lockdown because of the pandemic. But we did see a rise in unemployment, and many young people and their families were hit really hard by that. But it wasn't as bad as was feared at the beginning, partly because of the actions of government, the furlough scheme, probably not Kickstart, although it'd be interesting to get comments on that. Partly the actions of employers in terms of wanting to retain workers and young workers in the sectors they were working in. Brexit was there in the background as well, and the impacts of that at the top of their minds, but also the behaviour of young people themselves. So we're seeing a lot more young people kind of seeking refuge within education rather than braving it in the COVID labour market. And that's taking a while to kind of unwind as we get back to normal in inverted commas. So we're seeing relatively low unemployment, relatively high rates of engagement in education, but high levels of economic inactivity as well. So what we're left with post-pandemic is a situation where it seems like the problem has gone away from some perspectives, but it's really hidden in those economic inactivity figures where there are young people with particular disadvantages and from marginalised groups who need a lot of support to get back to be looking for work in the job market. So that's where the focus needs to be now post-pandemic, but I'm not sure that that's where the thinking is at. It's almost as if, okay, we've managed to weather it and it was a very, very difficult time, but that problem is a bit hidden now. We need to make sure that that is seen and taken action.
And yet we know from the 2008 global banking crash and the wealth of research done around that there is economic scarring for people who leave education at the point of crisis. And here we are with fears of, stagflation and/or a recession, possibly both. Who then are those young people who just come out of education who you're worried about getting lost? Is it the ones who are coming out now, or the ones that came out over the last couple of years who somehow will have fallen through the system because of everything that was happening?
Yeah, I think, well, it is both, but there are perhaps different solutions to each. And if young people do become neat, they're likely to stay neat for longer term. I mean, there are some neat young people who, for whatever reason, are less of a concern. But those with low or no qualifications from marginalised groups or with other characteristics, I mean, it would be difficult for them to go back into the labour market. Each needs a bespoke approach. So I think it's thinking about those 700,000 young people who are neat right now, breaking down, what are their needs, what are their routes to back to employment or education, part-time or full-time. There's lots of different options for them. I don't think government is thinking DFE, DWP together in a joined up way about how to get those routes back to employment and education for those young people. And that's where the key is, that DWP, DFE barrier is causing all kinds of problems in practice in terms of how a young person finds the best route back to a fulfilling career.
Tina touched on this right at the beginning, and I think Amy did as well, is that we could have had a transformational moment, that there is an opportunity. Do you think that moment is still here for us to really think about what we do around that big pivot point at sort of 15, 16?
It could be. I fear that it may be lost for reasons I've said, and there have been some other distractions on government's mind over the last few months. But I think it's imperative that we do seize that moment. And so many changes have happened as a result of the pandemic that the panelists have talked about. We're already seeing things change, and that provides a momentum that I think can be harnessed.
Okay, so I want to go to John and then to Tina. So John, what would you like to see change as a Matt coming with the philosophy that you offer many options to young people? Was this a transformational moment that has been missed, or is there something that could be done now?
Well, hopefully, as we said, there's still some thinking to be done around that. I mean, one of the things in terms of the brief before today, one of the questions that we were asked in the series, what would we do if essentially we became the education secretary moving forward? And one of the things that I would encourage is a multi-academy trust that wishes to catch as many young people in and not catch young people out. I would like to carve away everything that we're doing at the moment around assessment and exams and have a complete rethink around that. We talked a little bit before we came up around some of the thinking, particularly around GCSEs, although there doesn't seem to be a huge amount of political appetite for that at the moment. We must, as a country in the 21st century, be able to go back to better ways of assessing young people, even as young now as reception moving forward, than just repeatedly testing and examining them. We must be able to do better than that. We must come up with assessment strategies that catch young people in. We used to have qualifications that involved a lot of coursework. So coursework was something that could reward young people for work that they could do over a period of time, where they could be organised, they could talk to people, they could research, they could present, they could meet deadlines, they could be rewarded for things that they could do, rather than sitting, well, we've got some young people that sit somewhere in the region of 25 GCSE exams for up to 3 hours, you know, a piece. There's got to be better ways of assessing young people just than that.
Would you scrap GCSEs and go for a broader range of qualifications, some kind of leaving certificate in the way that some other countries do?
No, look, I think GCSEs play a role again. You know, so for the Canterbury Academy, we have a grammar stream. Again, just to give some context, Canterbury is an acutely selective area of Kent. There are 3 grammar schools in Canterbury. There are 2 denominational schools. There's 3 fee-paying schools and 1 non-selective comprehensive, which is the Canterbury Academy. I think GCSEs play a role. They're certainly worth something in terms of academic qualifications, but for those young people that might not work for, something like a hybrid version of a leaving certificate could be a better way of shaping their education moving forward. And again, I think we're going to move on to talking about needs. So again, we have excellent NEET figures, but that can sometimes come at a sacrifice for schools as well, because those students aren't necessarily leaving school always with the sorts of qualifications that the Department for Education or Ofsted might like them to have. So we're always wanting to do what's right for them and for their future, rather than what might be right for our league table position across our schools.
So if I can bring Tina in, you were nodding at a lot of the sort of thoughts around this is a transformational opportunity. Where do you think that should go? And what would really sort of regain some of that lost ground around inequality?
I like getting big questions. I think it's mental health, actually, mental health and well-being. I think we underestimate, perhaps. We're also keen to get back to some kind of normal adults and children, and forget that for children, so much security has been taken away. They've seen their parents out of control. They've seen their school closed. I mean, they've experienced changes they've never done before. So I think and we see the effect of mental health, both of the parents and the children, on attainment all the time. So I think the transformation we need is in mental health and well-being of young children. And I think we need it for everyone, so that then the mental health services can focus on the ones who really need specialized and additional attention. That would be my one call for transformation. Yes, I think that would make the biggest difference.
There's a really interesting project underway in Greater Manchester using the ONS questions on wellbeing across a cohort of teenagers. The academics and local authorities involved in that would be quite interested to see it go UK-wide. Would that be the kind of step that might give prominence to teenagers' wellbeing, and in a way that we could track into adulthood?
Absolutely. I would start much earlier, though. I would start with the children in nurseries and in primary schools. I think we're seeing a much higher level of children being worried and anxious even before the pandemic, and I think it's been exacerbated by the pandemic. So I think it's helping, and we had papers about the early years and practitioners wanting to be trained to help with developmental delays, but I think also anxiety and worry. So yes, we need national programs, and I think we also need to invest in schools and nurseries so they can provide the groundwork for mental health and well-being, as well as supporting parents in providing that home environment.
And of course, we have that preschool cohort, which will be coming into a reception for years to come. How important is it not to lose track of those very young children who've missed out on key speech and language development, social development?
Hugely important. I think in my mind, I think we have a story of two halves, though. We have there's a particular age groups who've been very much affected by COVID, particularly the ones who've missed out on the transitions, who've had to do the transitions online, who had to learn reading online practically. I think John will agree with this, the ones who transitioned to secondary school online. There are particular year groups, as well as particular groups of characteristics who've missed out and whose disadvantage in education has widened enormously. I think those groups we need to focus on. But then also, I think the wider picture that everyone's been affected and that the transition will carry on
being difficult.
Amy, could I ask you to pick up on Tina's point about mental health and well-being, because we know that referrals to CAMHS, and that's like getting through the eye of a needle, but those have gone absolutely through the roof. How much is getting the school's community back on an even keel needed before you can then really begin to think about educational attainment?
Yeah, I mean, I think, so in my first answer, I was talking about how schools are really reliant upon additional sort of systems and organizations, CAMHS being one of them, and the data not being sort of available in the round. I think that what we're seeing, particularly in schools serving low-income communities, is just the weight of additional responsibility those teachers and leaders are having to carry on behalf of their kids in order to serve them. And when you talk about going on to an even keel, these teachers and leaders, they have sort of significant timetables, and then they are working all the hours on top to both plan quality lessons and deliver amazing provision for their kids, but also in service of all of the additional challenges that their pupils are experiencing, mental health challenges, the list goes on, poverty and everything we've heard of today. So I think one of the things that Teach First we're really trying to encourage through our, we have a recovery manifesto, is this increased pupil premium for increasing the pupil premium, but particularly for those who are persistently disadvantaged. So for those who have had free school meals for at least 80% of their education career. So asking that for those kids, for the pupil premium to be doubled, so that those schools in particular can better fund, can have more resource and more funding to be able to cater and counteract the challenges that those teachers and leaders are experiencing. And then in addition to that, making sure that particularly another thing we'd like to see really is for schools serving the 1% of most disadvantaged communities, that again, their funding is increased so that they can explicitly increase their teaching staff. We know we have a teacher retention crisis at the moment. We're seeing far fewer teachers entering the profession than we did pre-pandemic, and I think we could explore the reasons for that at another time. We have to see more teachers entering the profession. We talk about an increased salary that's been delayed, but that will help, of course. We have to see more teachers. We have to see more teachers entering the schools that need them most, to allow them to have more time to serve their kids better, to get on the even keel that will then in turn and in time relieve the pressure of other systems such as CAMHS.
Quite a lot of the education recovery funding wasn't targeted. So the education catch-up premium that went to per pupil to all schools is not clear that the national tutoring programme has been targeted in its latest iteration at the most disadvantaged. You know, there's been more of a drive for the numbers overall. Was that a mistake? And is it really, I mean, you're essentially saying we've got to prioritise much, much more.
Yeah, I mean, I think we absolutely have to prioritise the kids that need it most in the schools that serve them. I think, so the NTP funding will now be allocated via pupil premium, so we will see schools being given their grant in line with their pupil premium figures. We haven't seen that to date, so I think that is a step in the right direction. As John alluded to, the schools are given greater flexibility now as to how to spend that grant, which I think is absolutely the right thing. Was it a mistake? I think it's really hard to look back 2.5 years and the decisions that we made in haste to try and serve millions of children who were not in education through no fault of their own. I think it's very important now that we allocate funding according to need when there is such limited funding. We need more funding in general, but I do think it needs to be allocated according to need.
Chris, there is a renewed focus on skills, you know, I mean, actually more conversation about it across the main political parties in the last 2 or 3 years than probably the previous 15. But a lot of it at the moment from the government is focused around the introduction of T-levels. Where does that leave the long tail of teenagers who, as we return to normal assessment, will be left without their English and maths or without their 5 GCSEs, which we know is a threshold that has life-changing effects.
Yeah, so I think going back to the impact of the lockdown on young people, we kind of planned for the economic impacts from the furlough scheme, but there wasn't really any support for the mental health impacts of lockdown. And I think it's a bit of a myth that young people are kind of ignoring the rules and going out and partying. But I think most were actually just obeying them and staying in and getting quite isolated and not taking part in the activities that they would have normally done. So, and I don't think that really is being considered in terms of what are the things that need to be put in place post-pandemic to deal with that. And that is going to have an impact, a lasting impact on people's opportunities and their prospects. I think that although T levels are being talked about, they're unproven. We're not quite sure whether the support is going to be there in terms of the opportunities to get that work-based element to it. And it's just not enough. I think if I was in the position of being the education minister, I'd be going and talking to my counterpart at DWP and saying that this isn't working. We need something that is cross-cutting, but part of the infrastructure of support and policy making for young people. And we need to be talking about vocational training all the time, not just when we're talking about T levels. That has to be given priority because those are the options that work for young people that we're most concerned about. And if those, it's still stigmatized to talk about vocational opportunities for young people in a lot of situations. And you're seeing that in the key transition phase after the end of compulsory education, where the model is assumed there's a 2-year A-level period and then you're off to university. It would be much better if there was more flexibility, so that there was a kind of 3-year period allowing for a bit of trial and error for young people who perhaps don't quite know what they want to do exactly. They may need more support in their maths and English. They may need to go back to college to do that in a different environment away from the school. So having that flexibility, allowing young people to make a few errors but not be punished for it, I think would really transform the opportunities that are available.
And briefly, given where we are in terms of the economy, you touched on the difficulty of getting enough of the working hours that you have to complete your T level. And that, of course, has geographical challenges for some T levels. We may see a very strange pattern of what's offered where. In terms of other vocational opportunities, isn't that going to be the same challenge as employers retrench slightly, frankly, faced with a whole set of challenges?
Yeah, I mean, that's the thing. On the other hand, in terms of what's happening in the economy, you've got vast numbers of vacancies, but are they in the right places? Are they in the right sectors? Are they the kinds of jobs that young people should be going into? So we really need to understand what's happening there, what's happening with the supply, and have a better match up over time in different places across the UK.
Well, we've heard a whole range of solutions there, more focus on well-being, on looking holistically at children, a wider range of options and assessment. If any of you have any questions for the panel, or any of our online audience would also like to bring in questions, now's the time to come into the conversation. Would anyone like to ask a question? Gentleman at the front, and then I'll go to the lady behind.
You all talked about mental health and well-being. I was wondering if you had any thoughts on the role of school and the education system in supporting physical health and well-being, and whether there might be a role for universal provision, food, enhanced physical education activity in that.
John, I think, yes, that naturally falls to you.
No, I think it's an excellent question. Of course, there was, for those of you that remember, a specialist model of education, pre-Tory government, Labour government, the specialist schools programme. Sports colleges existed as part of that. The Canterbury Academy was very proudly a sports college, and there was a huge emphasis on physical fitness for young people. Not in terms of kind of statutory fitness tests for everybody, but it was very much something which underpinned all the work that happens across the Canterbury Academy. That also then reached out to local primary schools. So there was a partnership development program as well. Again, if I talk specifically about the Canterbury Academy, we worked with 32 local primary schools to make sure that physical health was absolutely top of their agenda. Again, it was something which underpinned all of the work that they did. So that wasn't just about the amount of exercise they were doing, but there were statutory requirements for the amount of physical activities that they did each week at that particular moment in time. Again, this is pre-2010. There was a huge focus on what they ate in terms of healthy school dinners and healthy meals. And as part of that as well, there was a huge focus on mental well-being linked to physical fitness and the benefits of that.
So what should happen now, I think, is what we're being asked. What should happen now? Should there be a national programme of some kind joining up all these elements of young people's and young children's well-being? Tina's nodding. Tina, do you want to chip in?
Well, it's the healthy mind and the healthy body, isn't it? And, I mean, my son does 10 minutes of yoga in school in case they don't get to their 15 minutes of sports at the end of the week, in case they can't do their sports. So they do 10 minutes of yoga instead, has its benefits. But so no, absolutely, I do think it's about enabling schools to have playing fields, to have the time and the money to employ sports teachers and so on, to focus on food in schools, and to make sure that the free school meals are of high quality. That's all. It's the emphasis on well-being, by which I mean physical and mental well-being. Absolutely. And actually, Bran, when you talked about tracking children, and SWETA studies, SEED, the study of early education development, is tracking children throughout. We have the mental health study of children and young people, which is looking at mental health and school attainment, and the Department for Education is commissioning 4 cohort studies for early years, primary, secondary, and then post-16 students, precisely to capture this kind of very much affected cohorts. So I think we're going to find out a lot more about these children as we go on.
As we go on, great. And there was a question, I think, from a lady behind. No, it was a, am I imagining that? Any other questions from the audience here?
What role might selectivity have making worse or ameliorating or
John, I'm going to ask you to answer that briefly, because you are working within the context of grammar system, but then also to bring Amy in.
Yeah, so selective education certainly plays a role. I can only speak again in terms of context in Canterbury and across Kent, the students that take 11 plus all the grammar school tests and then opt to go to grammar schools, and grammar schools play a role in terms of pushing those students on to really high-end academic attainment and outcomes. At the Canterbury Academy, we have a grammar stream of students. The students in that grammar stream for whom that particular education is appropriate actually make more progress than our partner boys grammar school. They don't attain as highly, but the starting point for the boys at the grammar school is a higher position to start with. But the point I would make about grammar schools, again, I want to be a bit careful about how I present this. So I have no issues with grammar school education. It absolutely plays a role. The way that some young people get into grammar schools may not always be fair and equitable. Lots of young people in the area where I work, they're very used to getting told no. No is one of the first words they learn. No, you can't do that. No, your postcode is wrong. No, you don't have enough money. No, you can't go to that school. No, you can't go to that club. And often money can buy a better route for you, and parents that are familiar to working in a system and are articulate and well educated themselves can shout slightly louder and get more attention. So it's more about the way that some people get into grammar schools than the job that grammar schools do. I don't know if that answers your question at all, but that's just a perspective from me.
Amy.
Yeah, I'm going to be less careful. And unsurprisingly, teach first, and perhaps I won't speak on behalf of Teach First and speak for myself. I think we should aspire to a time when there isn't a need for any grammar schools. The evidence suggests grammar schools do very well. Let's be very clear. Grammar schools serve the pupils that go to grammar schools brilliantly. What they also do is widen the inequality gap. That's all of the evidence points in that direction. they are well-resourced and brilliant places to be educated. What we want is a country of schools that are well-resourced and brilliant places to be educated, that serve equally all of the kids, irrelevant of their postcode. And there are areas of the country, Kent, Bucks, others, where you might not be paying private school fees, but you're paying through your mortgage, or you're paying to relocate to that affluent area. So it's an equivalent fee structure, albeit. So it's not that grammar schools are wrong, it is that they do widen the gap. And what we'd want to see is the same level of resourcing and quality of education in all schools, serving all kids.
And Amy, just to sort of pick up on something you said earlier, which relates to this, the most important thing is having good teachers in every area. And a lot of people are thinking about leaving the profession because it's been a tough couple of years. The previous national attempts to try and parachute teachers into some very disadvantaged areas, aside from Teach First, actually haven't worked terribly well. There's still all these marginal areas where actually it's very hard to get young people to go and work.
Yeah, I mean, it is really, really hard. And so one of the things that we are trying to do at Teach First, so 20 years ago when I trained to teach through Teach First as a graduate, we were just placed anywhere, and actually at the time it was only functioning in London, so that was all very convenient actually as someone who wanted to move to London. But now we see people who are reluctant to go to more coastal or rural areas. So what we're really focusing on is we need people to want to stay in their communities as well and to serve their communities. So we both attract teachers who are very flexible and can be deployed wherever they're needed most. So really supporting schools who struggle with recruitment and can't fill their vacancies, and those kids have just terms and terms and terms of supply, which is not ideal at all for staff or kids. But also looking to make sure that we have a really homegrown pool, so kids from the community can then go to university to study, to qualify, to then come back to teach in the community, and really ensure that that is also a really fulfilling and ambitious way of giving back to their community. So I think it's both.
And does that require, Chris, in the way that you've been talking about in other respects across the benefits, training and education systems, how do you get through those silos? Just a brief thought on Whitehall operates in its own departments, and actually cross-departmental strategies are rare and rarely effective.
Yeah, well, it's an age-old problem, isn't it? I think you do need belts and braces to break through it. And if you had a combined responsibility across education and employment, as well as obviously DFE and DWP responsibilities, that would help to break that down. At least you'd have somebody whose responsibility was the gap, or you have the different commissions that operate in this space doing joint reports. So the Skills and Productivity Commission, Ofsted, other organisations come together to do a joint report on what needs to happen about those transition periods, particularly early employment, apprenticeships, traineeships and education. So there are ways around it, but it needs to be both, not one or the other. I think otherwise those silos are just too strong.
Chris, thank you very much indeed. And can we thank our panel very much? We're running out of time. I know some of them have to get back to them. Thank you very much indeed. I'm going to hand over to Sue to conclude the day.
Thank you very much, Bramwyn. Absolutely wonderful final session. So yeah, just to finish, I mean, our focus today was on taking stock and finding solutions. We've certainly spent a lot of time, I think, thinking about the first of those, and I'm sure we've all learned a huge amount today. We had a great lineup of speakers, and personally, I've certainly learned a great deal. And I was particularly struck by Imran's graph this morning. And indeed, I know quite a few of us were, because we were talking about it over lunch, but that absolutely consistent gap in attainment, even as the attainment of disadvantaged young people was rising, the gap remained the same between the more affluent pupils. So we know there's a huge amount of work to be done. And that was pre-pandemic, I think, for a lot of the figures that you were showing us. And now we have the cost of living crisis on top of all that. So there's a lot of work to be done. We all know that. So as for finding solutions, I think we all know, of course, there are no silver bullets, but what we've certainly learned today, I think, is about the importance of a nuanced intersectional analysis. And we've seen some fantastic examples of that in the presentations today, including the importance of place, as Jonas spoke about. And I think we've also seen the richness of some of the data that we have in the UK, and which NatCen in particular is so good at harnessing and using in its analysis. So I think there's some great work to build on. But I think most importantly, or as importantly, we've been reminded about the importance of listening to children's own voices. And for me, I think the voices of the children involved in Claudia's research in the session this afternoon will stay with me for some time. I think that was very powerful, what you were talking about there in your findings from the cost of the school day project. And indeed what John was saying about some of the things that you've been doing as a school to meet some of those issues. And so I think I can only echo Tina's call for more child-focused, child-led research. I was interested that Branwyn also mentioned the Wellbeing Project at Manchester, which is led by a colleague of mine, Neil Humphreys, and I would recommend you have a look at their website if you're not familiar with the Wellbeing. That's Wellbeing with a double E, because with the B being the image of Manchester, the city logo. And that particular project has involved virtually every school in Greater Manchester. It's an extraordinary project, including the independent schools as well, for the most part. I do recommend you look at that. So I think there's a lot of work still to be done, and we haven't begun even to see the longer term impact of COVID, not to mention the cost of living crisis. And I know that NatCen will continue to work in this space, and as we today celebrate the launch of the Children and Families team, I know that this is an area of work where you'll continue to produce high quality research. So thanks to everyone who's joined us today. Thanks for your attendance in person and remotely. Thanks to all our speakers again. Thank you to everyone at NatCen who has organised the day. I know there are lots of you behind the scenes who've been running around doing all sorts of things. I personally would like to thank Katie and Joshua, who I know have been doing a great job of holding it all together.